recorded.
Glad to see everyone on board this morning, and we will get started with our libraries. Ms. Hassler, it's a pleasure to see you this morning. And if you would, I know that you and your team have altered the way that you're serving the citizens each and every day. And I'd like you to speak to your daily operations and how COVID has interrupted your regular procedures, and anything else that you'd like to speak to before I open it up for questions.
Absolutely. Well, thank you, Council President Vincente, very much for this opportunity to talk about the library. With me today, I have Kathy Kogar, our CFO. We have a small group today. Our headquarters are being sanitized this morning until 6 o'clock. So Kathy is in the office providing oversight of that. And I'm sitting in my dining room, my new office. We have changed our services, and our whole delivery model will be changing for the foreseeable future. We were with the virus, as many of you know, because I know many of you are users of the library. We are very one-on-one, intense contact. So we will be changing that model when we do reopen. We do have a team in place that's planning our reentry, hopefully not too far away. We have canceled all of our programs through the end of summer and are now beginning to look at our fall events. And that includes our really big events like our author events, plus our bread and butter events like our story times and things that we do with the children. Our goal is not to encourage any type of group gatherings in our buildings, which is an entire paradigm shift for a public library, of which if you know our logo, it's come in, we're awesome. So now we're saying, don't come in, but we're still awesome. So our online resources, we have really been working with our vendors to extend them and to lift all the restrictions that the vendors put on people borrowing either an ebook or e-movie or magazines or reading the newspapers. It's been really, really rewarding in that sense that our vendors have been very, very cooperative with us. The other thing we've been doing is, you're all familiar with our school situation where we don't have high-speed internet access throughout the entire county. I refer to it as internet deserts, and some of them are along the northern part of the county. And then there's also some spots along Route 40 in Harford, Grace, and further along. So we offer free Wi-Fi at all our branches inside the building. And just by happenstance, years ago, we bought strong enough gadgets where it goes out into the parking lot. And depending on that building, you can sit in your car, or you might have to get out of your car and walk closer to the building, like in Norrisville, because the parking lot set back further. That has been a real bonus for some of our targeted communities that don't have the internet access at home. So we did put in an emergency grant through the Governor's Rural Broadband Service about 2 weeks ago for not too much money, about $23,000 and change, to boost our Wi-Fi capability out to 300 feet beyond our parking lots. So we're very excited to say that we received notice last week from the governor's office that has been approved, and it will be going to the Board of Public Works on May 6th for formal approval. So we hope to get that up and running very quickly. We do have our vendors lined up to provide the technology piece, and our IT department are ready to get everything installed. And that, with the warm weather coming, and even if people practicing safe social distancing, interesting enough, we'll be able to have groups in our parking lot as long as they're doing everything they're supposed to be doing, accessing the free Wi-Fi. The other things we're doing is we're really supporting our community and publicizing a lot of the online story times, online courses that you can take for free. Maybe you've seen the Babbel commercial. We don't have Babbel, but we do have foreign language courses. We have our LinkedIn courses. So it's been an interesting time for the library, and our biggest challenge right now is preparing for when we reopen.
Thank you, Mary. Can you bring it up full screen? Council members, at this time, questions, and before I call on anyone, I just want to point out that Councilman Wagner is not with us this morning, but I believe Ms. Button and John Scotton are, and also Councilman Jan Giordano is still recovering, and he's not tuned in right now either. So with that in mind, Councilman, any questions for Ms. Hassler? Mr. Schroeds.
Yes, Mary, just as I slipped in, I heard what I wanted to hear, and
that's very welcoming news to hear about the boosters that you're going to be putting at the libraries. I know that it had existed at Norrisville. I had heard that it wasn't really working well, but I feel that this booster is really going to go a long way. And I commend you for going after the grant that you have gone after. I think that Harford County overall, we need to go after every grant that we can, regardless of the amount. You said, I think, $23,000. I think any money is a good thing, and I don't think any money is too small. So thank you for paying attention to that and finding the money. I think that that investment is going to go a long way for especially our rural community and those that do not have connectivity to the rest of the world. So thank you for that.
Thank you. Yeah, we're very excited about it, Chad. One of the things in Norrisville, the building sits back far from the parking lot. So the Wi-Fi does extend in, but your best signal is actually getting out of your car and going up near the windows. Right. And we have a robot that monitors our Wi-Fi and keeps our IT department up to speed on if there's any problems with the devices or anything. And we can make slight changes to the signal where it's going out of the building. So we've been working on that too. So it's been really interesting. I want to say thank you to our customers who send me an email or post something on the library Facebook page, because that's when we know when, say, B. Jeannie cuts the line up in Harvard Grace, when everything went down on us on a Friday a few weeks ago. Seems like a century ago now. We were able to repair it and get everything back up to speed really quickly. And in Harvard Grace, you can actually sit in the street, stay in your car along the side of the building, and you have full access to it.
Is there any way you can let me know once that project is complete so I can let the public know?
Certainly will, Chad. It goes to the Board of Public Works on May 6th. We are reaching out to the governor's office to see if we can go ahead and purchase everything and get it installed now. I believe we can, but I just want to make sure that we follow the grant rules. And then it should be up and running very soon. And it will go out. I believe my marketing person is trying to get me for the press release to say it's going to extend as far as the top of the Eiffel Tower, because I'm not very good at visualizing 300 feet out. That's always been a stumbling block for me. So it should be very effective, I hope.
Well, thank you. It sounds awesome. I appreciate it.
Thank you, Mr. Schroeds. Any councilman? Anyone else? Mr. Beulah?
Yes, good morning, all. And Mary, I just want to echo what Councilman Schroed's sentiments were for the amazing job that you do with our libraries and getting the grant money to extend the service. I mean, it's like you don't leave any stone unturned. You just go out there and not just with getting the money, but with taking care of all the citizens of Harford County. So thanks again for the amazing job that you do with our public libraries, because I feel that here in Harford County, our libraries are second to none. But we do need to work on Darlington there. We get you some money.
Well, we're so very excited about Darlington. We did acquire the property. It's a great partnership with the county executive. We were thrilled. And as you know, the module that we have in Darlington is separating. So we really want to do something so we don't, it breaks my heart to think of losing service in any part of our county. So we're very excited about it.
Thank you. Second that.
Thank you, Mr. Beulah. Ms. Haster, before I go any further, I know you have Ms. Kogar with you. Is there anything you would like to add, Ms. Kogar?
No, just thank you for giving us the opportunity to talk with you this morning.
Okay. Council members, anyone else? Any of our citizen budget advisors? Ms. Hergenhahn?
Good morning, Mary and Kathy. Mary, I've been a strong proponent of the library since I stepped foot in Harford County many, many years ago. I have a couple questions, if you don't mind. I appreciate both you and Kathy being here this morning. I know times are very unusual. Because the branch has been, all the branches have been closed, and you're asking people not to return any materials, and you're extending all of the overdue fines. Additionally, you have canceled all meetings in your meeting rooms in all the branches, what kind of economic effect does that have on your bottom line? Because they're revenues that you obviously count on for operating expenses.
Yeah, Cynthia, that is correct. We have waived all fines and fees since we closed, which was March 16th, through the end of June. That may be extended depending on the situation, what's happening. We also have had to cancel all meeting room bookings through the end of the summer because we don't want to encourage the group meetings. One of our other revenue makers is our passport processing. We haven't been doing that either. So it will have an impact. I don't know the exact amount yet because we haven't finished the quarter, but it will have a definite impact on us, our revenue. And I think my biggest worry is next year with the state funding. We know locally, I think everybody's done a really great job. The county executive, the county council, everybody to keep us, solid. Conservative budgeting is always a good thing in my opinion, because when that shoe drops, you have a little bit more room. At the state level, that's a concern because we do receive about 10-12% funding from the state of Maryland. So my guess is next, probably January-ish, we'll be, dealing with the budget again. So thank you for that question. Yes.
Additionally, the gala is an extremely large revenue source. And obviously I work with other nonprofits and the gala dates all seem to be moving targets at this point for not just the library, but all the nonprofits that have spring and summer. Where have you had discussions about, are you status quo? What are your expectations at this point?
Well, as you may know, we were going to hold the first rodeo, professionally sanctioned rodeo in Harford County in 18 years at the Equestrian Center in June on Father's Day weekend. It was a big celebration. We had 2 headlining concerts planned for that evening too. And of course we have canceled that. And that was going to be had a potential for a big revenue maker for us too. That's a real subgroup out there that we were looking forward to working with. The gala, the committee, the foundation and the gala committee has been working on what they're going to be doing. They're looking at ticket prices. We're even looking to see whether nobody even knows at this point in the fall if large gatherings are going to be even allowed. So we're on top of it to the best of our ability at this point. That will be a loss because we do generate usually net about 100,000, a little bit over for the gala, which goes directly back to our services, to our children, to our building programs, to all of that. So it's going to be a tough year. And my heart goes out to all the nonprofits. It's going to be a real struggle for all of us. So what I'm hoping is that we all kind of work together and support each other. What I didn't mention was an update on the Cultural Arts Board. They're doing very well, and they're taking some of the money that they had left over from the grants. They gave about $99,000 this year. They have about $30,000 left, and they're doing emergency grants to our independent artists in Harford County, and that grant opportunity is open. It opened about a week ago to the end of April. So we're trying to be very, very supportive in the community with our resources too. So yeah, it's gonna be tough, but we can get through this together, I think.
The library really is the heart of our community, and I'm sure that when we reopen, it'll be very responsibly, but I appreciate all that you and your team have done. Thank you.
Thank you, Cynthia. And when we do reopen, we'll probably open with services such as our drive-through windows, which I never thought I'd be saying this again, will be probably key to our reopening. Plus, we're looking at doing pop-up services throughout the county for the branches that don't have drive-through windows to get started reopening and getting. Our first focus will be the books, getting the physical books in people's hands because that's what they want right now. It's interesting how the world can change on you 6 weeks ago and your whole mental model shifts with it. So all good.
Well, all your friends' teams are with you. So thank you.
Thank you.
Thank you, Ms. Hergenhan. Anyone else? Ms. Hergenhan, can you mute your mic, please? Thank you. Anyone else? Ms. Hassler, thank you for coming. Appreciate all you do. Look forward to seeing you again soon.
Thank you very much, everyone, and have a wonderful day.
Thank you. You too. Next, Health Department.
Yes, good morning. It's Marcy Austin here.
Good morning, Marcy.
Good morning. I believe John Resline's on the phone as well.
Yes, I see that he's here with us. So what I'd like to do, Marcy, first of all, I want to thank you for your constant dedication and commitment to the citizens of Harford County. You and John Resline both, we appreciate you very much. And we know that you have an extra added burden on your shoulders, Marcy, with Dr. Moy being at home. I'm sure that you're in constant contact with him. I want to thank you for keeping me updated on all of the events surrounding the COVID virus. And I would like you to speak to that before we get into your budget, because I know you have an extremely important role to play here in Harford County.
Thank you. Yes, just to give you a rundown of some of the things we're doing at the health department. We have also shifted gears into a different way of working. So most of our programs now are teleworking, including administration, family health, clinical. Our clinical services, we do have about 7 nurses who are working daily, and they're doing all the contact tracing for the cases that come in. They hear about all the cases through a system called NEDS, and they are really working hard with the nursing homes and so forth. So we commend them for their dedication. They're actually working on site. Over behavioral health, we did have that huge problem of addiction. So with the behavioral health program, we've actually continued that program. The director there has completely shifted gears to telehealth. So they're doing groups, they're doing assessments, they're doing outpatient groups and psychiatric rehabilitation programs. For the urine screens, they're even using the crisis center to do that. And so nobody is coming in our building. So we're keeping those services running. Those are services that we depend on for collections. As far as front desk here, we're taking calls daily ever since the order came out about businesses and social distancing. So we're taking those calls daily. I'm keeping Mr. Vincenti updated if we have to do inspections. We're doing the best we can to give the businesses information ahead of time so they actually know what is needed in order to pass the inspection. And let me, if I could, turn it to John so he can give you a quick data update as well.
That's fine. Good morning, John.
Good morning. I'd just like to say that we've adapted as much as possible to continue field services in accordance with the guidances on social distancing and group sizing. So we're functioning fairly normally in environmental health.
Very good. I also I want to thank you for making the changes, I guess you did, in order to continue to keep businesses up and running, those that are able to continue to work throughout this COVID virus. Marcy, again, I want to thank you for your soft hand in reference to the businesses and the inspections that you're doing there,
Sure.
with keeping an emphasis on keeping our employees and our customers safe and secure. I appreciate all that. And John, with you as the head of the environmental department, we definitely appreciate you able to make those changes to keep us up and running and keep everyone safe in your department as well. Marcy, I see our new cases this morning are up considerably, probably the largest amount in a single day, if I remember correctly.
Yes.
nearly 30 positive cases.
That's
Do
correct.
we know how many negative tests we've had in Harford County? Do you have that number?
I don't have that specific number. I know they keep the total at the state level, but I don't have that number. I did speak with Vicki Bands over the weekend, and I asked about their drive-through just to get an idea of how many we are testing. And they're open 4 days a week now. And actually on Friday, they tested about 107 people. And she said there's been an average of about 80 to 100 people a day being tested. So that's why you're seeing the rise in the cases. But also, it doesn't feel like the community is rising as quickly as some of the other counties.
No, I would
We had a spurt there.
Yes, I would agree with that. If nothing else, Marcy and John, I'll go ahead and open it up to my council colleagues for questions.
Sure.
Council members, questions? Mr. Beulah?
Yes, just curious, and thanks for the job you're doing. We see this kind of or should I say we got more cases. How many of these 30 cases are from the nursing homes?
We had a lot of testing going on in the nursing homes last week. Offhand, I'm not 100% sure, but I would say most of those are either from the nursing home or employees there.
Okay. All right. Thank you. And again, thank you for the job you're doing.
Sure.
They're difficult times.
Yes.
Thank you, Mr. Beulah. Anyone else? Any of our citizen budget advisors? Mr. Tibbs?
Yes, thank you, Mr. Councilman. Mr. Austin, I was just looking at the budget and I don't know, temporary salaries, did you have to employ some more people for this core deal, or is that from something else?
What was that line item? I'm sorry.
Temporary salaries, that's increased about 200,000. It was only 200,000, now it went to 207, I think.
Yes, no, we have not hired anybody during this time, except if we had a vacancy. It's a rough time to start bringing people in, with having everyone teleworking. And so far with the contact tracing and the nurses, they're handling what we have so far. So we haven't had to hire anybody for that. And plus we have some people within the health department who can actually be trained on that. So I know they're talking about it at the state level, the contact tracing. I don't believe that we're going to have to tap into that resource. I think we're going to be able to handle it on our own.
Okay, I still just was wondering about the 200,000, that increase in the budget. That's what I was looking at. I didn't know if
that's actually what I'm
here. And Mr. Tibbs, the county executive was looking at the environmental health section of the health department, and he put some money into the budget so that we could provide some stipends. With them being a state agency, they're restricted to what they can pay their employees, and they're having issues with retention because they're putting the time in and training some of their environmental specialists that they're bringing on board, and then they're leaving for other jurisdictions that are providing them with more funding. And so we're looking at trying to help the health department out where we can, as far as providing stipends on top of what they're making through the state, so that we're not losing the talent that we're spending the time in training.
Thank you, Mr. Boniface. I was thinking that's what it was for, but I wasn't 100% sure. So thank you.
Mr. Boniface, thank you for that explanation. But if you would get a little closer to your mic, because you fade out as you move through your comments. Anyone else? All All right, seeing no one else, Marcy, John, we appreciate it very much. We'll be talking to you soon.
Okay, thank you very much.
Thank you.
Thank you.
Thank you, Mr. Tibbs. We're going to take a slight pause. Ms. Dixon, are you there?
Yes, Mr. President, I'm here.
You let me know when you're ready.
Okay. I'm going to see if we have a call-in user, 3. I'm going to unmute them to see if they are from the college. If you can bear with me 1 second.
Yes, ma'am.
Call-in user number 3, are you scheduled for a presentation this morning? Are you with Harford Community College? Caller using number 5, is this Mr. Hopkins?
Number 5 is me, Marcy. Teddy.
Okay, so that number 5 is Mr. Hopkins. Okay. Call-in user number 3, can you identify yourself, please? Mr. President, it does not appear we have anybody from the college with us as I look through our list here.
Okay, we did actually try to make some contacts as well and did not succeed in that. So we'll just move beyond them. Mr. Hopkins is here from Emergency Operations, and I believe we'll just flow into him. And if anyone should call in from the college, we'll pick them up in a bit. Good morning, Mr. Hopkins. How are you?
Good morning, Councilman President. How are you today, sir?
Just fine, just fine. Again, sir, if you would just kind of bring everyone up to speed with all that you're doing surrounding the COVID virus. I know that your department plays a huge role today, so and every day actually. So if you would please give us some background and then wherever you'd like to go for that before I open it up with questions.
Will do, sir. First off, can you see me and hear me okay, sir?
I can hear you just fine. You were on the screen, but I don't see you now.
Okay.
I see you now. Go right ahead, sir.
Okay, thank you. Well, good morning, Councilman President Cindy. Thank you for having me, and good morning to the council members and the Budget Citizens Review Board. I appreciate the opportunity this morning. You're absolutely right, sir. We've been extremely busy with planning and preparation for the COVID virus. As you well know, our agency becomes the lead in most every disaster event. This is one of the ones where we aren't the lead, but we're a strong collaborative partner. Health Department clearly has the lead on this, and we have worked very closely with Dr. Moy and his staff in a collaborative way to make sure that what we're doing is right and the best for our citizens in the county. Some of the things that we have been doing overall, just a very quick overview, a lot of planning and coordination, working very closely with all the cabinet departments as well as yourself and your staff, sir, on the COOP plans to make sure these last 8 to 10 weeks we've had successful continuity of operations and a successful continuity of government. We continue to collaborate with all of our county partner stakeholders. This is probably the one opportunity where we really truly see every handshake, every cup of coffee, every friendship we've developed over our many, many years of doing this play a huge role in what goes on. Because as you know, the first step in any disaster, the first time you want to meet somebody is not on the day of the disaster. And we have leveraged a lot of friendships and relationships these last 8 to 10 weeks to be as successful as we are being. One of the key things we're working on, you're well over, is equipment. That is the biggest challenge across the country. We are leveraging every source possible to get what we can for the county. That's been a difficult challenge. One of the helpful things for us in anticipation of the pandemic, we had back ordered back in January and February some supplies that would normally be used for other hazardous events, but could be easily used for this event. So we were very fortunate on being on the front end of having some supplies in the background, along with the fire service. Sadly, in a good, bad sort of way, some of the information, some of the equipment that we bought for the fentanyl outbreak that we had 18 months ago, we bought a large surplus of PPE, which we had kept stockpiled. which has served the purpose in as protecting first responders from exposure to fentanyl byproducts and byproducts of heroin overdoses. Fortunately, that same material and equipment we're able to use for this pandemic. So in a good way, we were ahead of the curve along those lines. As you're aware, we were creating weekly or have created weekly pandemic calls with the health department. I know you and the county executive and Mr. Boniface all participate in those. One of the first things we did in this pandemic was to create a JIC, Joint Information Center, which was to allow the proper flow of messaging and information to get out to all of our elected officials, all of our senior leadership, and as well as being able to manage the message that goes to the public. We are linked in with every state across the nation, and we're also, through our DHS calls, we're also linked in with every county across Maryland in regards to what they're doing and how they're responding, because we are learning lessons from how we do things from each other. Working in concert with Mr. Boniface, Ms. Myers from procurement, and my other cabinet colleagues, we were able to secure a hotel in Aberdeen for first responders. That way, if first responders were unduly exposed to this virus, we were able to provide them a safe environment in which they could quarantine away from their families. And that hotel it'll still be operational for at least another month as we work towards our peak for this virus. We also set up a system of integration of the commercial ambulances with the volunteer and career-based EMS services. Again, in being fearful that the pandemic was going to take a far worse turn for us, we wanted to be out in front of that. So we've actually integrated a commercial service. We pre-positioned them throughout the county, and they're there to help us pick up either overflow for high volume of EMS calls, or if we had an unusual high number of first responders that would go down due to maybe contracting the virus. So these ambulances were put into play, and that contract will extend through the middle of May as well. We were working very closely with Amber Schroeds and her department, as well as state officials, to create a child care opportunity for first responders so the first responders could come to work and know that their children were in a protected and safe environment. And as I mentioned to you earlier, we are working very closely with the health department especially on this nursing home issue that's taking place currently. And we have partnered extensively with Upper Chesapeake in helping to manage and help them as well where it's necessary. One of the I think, best things that have happened to us so far, and I know in your previous report a few minutes ago to us, Marcy rather, you noted that the call of COVID cases is up, which is true. But across the board, our EMS call volume is down to historic lows. Over the last 5 to 6 weeks, we've probably been running anywhere from 20 to 35 calls below the normal volume of calls for service as it relates to EMS. People were following the mandate, staying in their home. They were only calling for ambulances when, in fact, they had an emergency and needed so. Our reduction in terms of fire calls and other type of emergency calls for service are also down. So that in a good way has been helpful because it's kept people off the streets. It's also helped keep a manageable flow of patients into the emergency department because people just weren't going to the hospital. What we're seeing now with warm weather and with the governor's report from last week that he wants to get Maryland on the road to recovery, we're now starting to see people who have chronic illnesses who now want to go to the hospital are now calling. So we're starting to see a slight uptick in our calls for service, but it's extremely, extremely manageable. And I think it's very telling on how this county was prepared and how our citizens responded, because our numbers across the state, when you compare it to other metropolitan jurisdictions, we're low. Sadly, the number is creeping up. I get that, but we're also low overall. And that's a testament to the people following County Executive Glassman's directives, following the governor's directives to stay inside and protect each other. So with that, we've been doing this and a lot more. I have a very talented staff. I'm very proud of them. Because of what we do, we're positioned to work essentially from anywhere we need to be at all times. So it allowed us to be pre-prepared for that so that Director Kuba could then use his assets in IT to share them with the rest of the county because we had already had our assets in place so we can really work anywhere. So with that, I'll stop and I'll be happy to take any questions, Mr. President.
Thank you, Director Hopkins. Appreciate that thorough presentation. And I agree with a lot of the points that you made. Absolutely. At this time, I'd like to open it up with our colleagues, council members. Mr. Woods.
You didn't even look at me. How did he know? He didn't even look at me, see if I raised my hand or anything. Just throws it out there. Good morning. Once again, thanks for being here and thanks for everyone up in your department. We just finished up the week that we celebrate and acknowledge our public safety emergency telecommunicator workers, and it's a shame we didn't get to do what we normally like to do and actually be able to be there with them or say thank you personally, or even at the council like we have in years past. But just let you know that every member of this council appreciates every one of our dispatchers, call takers, and our public safety personnel as well. I explain it to everybody that I can possibly tell that it is the most stressful job you could possibly have in public safety, and without being actually have your hands on a patient or actually on a fire hose or something of that nature. And I feel for them every day. With that, I know we're still doing a lot of changes with Next Gen 911. I see a large chunk of money in our budget is going for Next Gen 911, which of course I was a huge advocate for. And I think it's a huge step in the right direction for 911 nationwide. Can you explain a little bit where we are there and what we're seeing and what's coming up?
Well, we are halfway through the process. We expect to go live with the new CAD system next spring, and Next Gen 9 will move even further into that. As you know, it's an incremental process where we're at this point, but we're there. We're about probably a year to year and a half away from being fully operational with that, which will bring a lot of new technology and the ability to manage calls more effectively and more efficiently. So it is a stair-step process, but we're making good progress.
That's outstanding. We talked last year about some of the mental health and that of our call takers and dispatchers, and you took a lot of steps on yourself to make sure that they're taken care of. Has there been any work with the new Harford Crisis Center that works out with them if we need any additional support? Or I know you had some plans in line with that. I just didn't see any. I don't know if you have a line item in the budget somewhere for taking care of mental health needs up there other than what we do with through our regular insurance. But I know you talked about that once before, and I was just curious what's changed or what you're doing now.
What we've done, you're absolutely right, Mr. Woods, and I appreciate your attention to that, because it is an unseen element that the dispatchers go through. You know, you can see stress in the face of a firefighter or a police officer because of what they see on the street, but it's not often recognized that the same stress that the officer or the paramedic deals with in the street because they're working on the patient is really experienced also by the dispatcher as well, or the call taker, because obviously it starts with them. While we have not involved the Harford Crisis Center on that level, we have sort of talked about it, but if you're referring to the Client's Family Crisis Center, is that the direction you're thinking, sir?
That's correct. Correct.
Okay. We have been working very closely with client's family from the overdose, the addiction side of it. Now, we certainly know that they have resources available for us if we need them, but we haven't gone that way because it has been mainly focused on mental health, addiction, alcoholism, things of those issues. And we have, I want to make sure that I don't go off topic too far. From this dispatcher standpoint, we have a peer counseling team in place. We keep an eye on the calls for service, and we just intuitively know which calls we think the dispatchers will have a hard time with. Case in point, we had a fatal house fire last fall in Edgewood, where we are, through the investigation, we're reasonably certain that the person who died was talking to a dispatcher seconds before they died. Because of our liaisonship and partnership with the Sheriff's Office, I found out very quickly that that person was a deceased person. We immediately reached out to the dispatcher, made sure they were okay, did they need anything, any services, and talked it through them. In this case, the dispatcher was a seasoned veteran who was comfortable. They did everything they could, but recognized that unfortunately those things do happen. But we do have other situations where we do have peer support in play, and we'll send our team members out to talk to that person and make sure, just to kind of engage with them, make sure that they're okay, and walk through the process. In terms of the Client's Family Crisis Center, yes, we meet with them every other month. We are looking at ways that EMS can be involved in the process of assisting addicts prior to to getting to the Client's Family Crisis Center, or how we get them there. We're also working with them. Ms. Schroes, through her office and through the Crisis Center, have developed a peer recovery program. While peer recovery was an idea where they wanted to put these folks on the EMS units with us, it was sort of an unrealistic expectation, because the peer recovery coaches would not derive the best benefit from riding with field providers, because we don't run overdoses every hour of every day, which would keep them engaged. But we did find a way to managing HIPAA compliance, managing protection of all the information. We're able to share information with the Client's Family Crisis Center so that any overdose victim that we have in the county that information can be forwarded, legally protected, to the crisis center so their peer recovery coach can then engage with the person who suffers from the substance abuse or the addiction, and then I'll be able to offer them services. So, you know what? It's EMS is a tough nut to crack sometime, and because of the way we operate, sometimes it's damn near impossible to integrate certain community health services with EMS. We're doing everything we can. One, and at the risk of sounding self-serving, we believe that's a very important program, and we want to be a part of it. But we also know that our people see these people in the field, and they're the first line of help. So if we can get information from our EMS reports to the peer recovery people at the crisis center, then we know that we're contributing towards their mental health and well-being. I know that's a long answer, but I'm hoping that helps answer the question.
Oh, it does. It helps a lot. And it's amazing over my 25 years how much EMS has changed also to our, not just the level of care that we provide, but the type of services now that we're providing or getting people in contact to. 25 years ago, I remember maybe once or twice I ever reached out to community services or child protective services or something of that nature, or even adult protective services. Now, I mean, it's something that we do much more on a frequent basis, and we're getting that information to the caller much quicker than we ever had before.
And one of the benefits too that we were also doing, Mr. Woods, is not quite all, but most of the volunteer companies and clearly the county medics are participating in the Leave Behind Narcan program. I know that the volunteer fire service had concerns about it when the program first started, but we were able to mitigate most of their concerns. It is a voluntary option to participate, but that is something we work with Dr. Moy's staff. They provide us the Narcan. Then we hand it out to the fire service and then they provide us a demographic statistical sheet back that we give to the health department. But it's at no cost to the fire service, no cost to the county. We replace Narcan and then leave an extra dose at the scene of overdose cases we respond to. So they are participating in that. And one other point, if I may, sir, too, one of the challenges we've had in terms of mental health and well-being, and it's interesting with the National Telecommunications Week, why it's been so helpful, is that we immediately shut DES down when this pandemic started creeping up because we needed to have a pristine environment for the dispatchers to work in. And while they feel very safe coming to work because it's a lot, I mean, absolutely nobody, including myself, goes into the dispatch center. Dispatch consoles are disinfected at the beginning of the shift and at the end of shift. A lot of protection taking place. But what that has reduced for us is that lack of physical contact where we can go in and console a dispatcher who might have some issues or congratulate them when they've had a successful call. We've had several successful cardiac arrest saves in the last few weeks where we like to personally congratulate those dispatchers, and all I can really do is send them a thank you email. So we've been very much in tune and trying to stay on top of that. We do weekly calls with their staff where we bring all the staff together on a WebEx and give them all the information that's current as of that week, and then invite them to ask questions. So I do appreciate you bringing attention to that, and we do strive very hard to make sure our people's mental health is in check.
I wasn't actually going to bring this up, but I figured since you just kind of did. I remember at the beginning of this epidemic or pandemic, when we were sitting at the dispatch center or at the EOC, I thought back to the old building and how this pandemic could wipe through the old building and how easy it would because of the open format and how everybody was right on top of each other. So I'm very thankful we had the building we have now. And of course, I think it would help out more if there was still something along the lines of the phase 2 or the second part of the building. I know there's some talk somewhere about maybe bringing something that back up. I'm not really asking you about that right now, but my support for phase 2 and keeping the field providers in a separate spot for things like this is more crucial now than it's ever been before. I know we have limited providers that are in that building, but still between the foundation and other people that could be in that building separately, it just goes to prove how beneficial something like that would be.
Thank you.
The 50-50 model with the change, can you go into that with the payroll reimbursement? I know I've had a couple questions about that so far, and that is also going to go into a question about EMS billing and how the county is handling EMS billing right now. And if we're looking into the future, knowing that we have such a decrease in EMS calls, both volunteer, fire, EMS, everyone, that how much of an impact do we think that's going to cause to our EMS billing?
Ms. Woods, I apologize. You said the 50/50. Are you referring to the Stafford Act or?
Oh, no. No. About the 50/50 reimbursement, and we used to. I'm dealing with the foundation right now. Foundation and us, the split between the fire service and the county was.
I'm with you.
Yeah, sorry. I threw three things at the same time. I should have separated them.
No, that's okay. Starting along the lines, I believe the foundation is on, we'll be making a presentation to you later today, but I think the model that they're going to, and I'm appreciative of their desire to work closely with us and the administration, but the model they're going to will put bodies in the seats. Right now, the model they followed for a number of years was successful, but as the volume of calls prior to this pandemic was increasing, the need really is for each fire company to have a driver and some sort of ALS or BLS clinician. Because while a unit can go out driver only and provide care, your transport unit is still coming from a distance away. So from a clinical standpoint, treatment standpoint, the model that will be discussing with you in their budget, I would assume later today, would be just that. We need to have bodies in the seats. As the county slowly transitions to a career service, we're headed in the right direction, but we all know that that's a tremendous undertaking. And the foundation has been an awesome partner in allowing that transition to go smoothly and allowing it to be absorbed by the county over time. So, and I think in order to meet that mandate, that 50/50 model I think will help them overall. I don't know, and in terms of projecting how that will look projecting and going forward, I don't have a number right in front of me, to be honest with you. We could possibly look that up, but I think it's the right step for them. Does that answer for the first part of your question, sir?
Yeah, it does. And I think you're right. I mean, I would like to see more ALS coverage, but at least we can start here and move forward. I'm glad to see Folsom's getting an ALS provider. I'd like to see something else up north, but I think that's going to come online with the plan for the North EMS station anyway, but I'd like to see something quicker for them. I'm talking about Chad's area, of course.
One of our biggest problems, Mr. Woods, as you know from the service, is the ability to find ALS clinicians. There's a large part of me thinks that, that I wish I would have kept my paramedic status because, I'd like to be even more help because of having that. But ALS clinicians are just extremely difficult to find. Counties are robbing Peter to pay Paul, if you will. So whomever we hire and pay, the next county over, if they need them, they'll find a way to bump up and make it difficult. So the challenge is it's easier to find BLS clinicians. They're a dime a dozen. So I agree 100% with you. My goal ultimately, and it's why when I helped design the first our EMS system with the county executive and Mr. Boniface, that putting ALS crews was the right way to go. But we had so many challenges in trying to fill those vacancies and to find the right people. So the foundation model of going to the BLS clinician gives us patient care to the scene quickly that can be supported by an ALS chase truck. The other thing, and I don't want to quote numbers that I don't have in front of me, but I do know that because we over triage in 911, and when I say over triage, I don't mean like overkill. We over triage because we follow the emergency medical dispatch protocols. Those protocols have certain questions that we ask the patient. If any one of those patient questions hits a threshold that suggests ALS intervention might be needed, we dispatch the call as an ALS. By way of an example, a person who's having an anxiety attack because of whatever issue, they will present, as you know, with difficulty breathing, shortness of breath, chest pain, tightness in their chest, all the conditions that align with a cardiac event. The problem, so we alert it as a cardiac call, but in reality, when you get there, it ends up being a BLS call. We can't make that call. The dispatcher can't make that distinction on the phone. We can only go off the questions. So in a good way, we over triage, but maybe in a bad way, we over triage too, because sometimes it might put a seemingly unnecessary burden on our ALS resources. But you're absolutely right. I mean, I would love to see ALS clinicians in the car, but at least having care at the scene by a driver and a BLS clinician treating the patient, they can start care. do everything they possibly can, and even meet the ALS clinician en route to the hospital if need be, or another ALS transport unit en route. But I don't disagree with you. I'm on board with that concept.
Thank you. And the final part of that question was EMS billing. How's the county handling EMS billing? I didn't see where that is on projected income, or and I'm like I said, I'm gonna ask the volunteers that later on too. If there's any thought of what we're going to do with seeing this major decrease in our EMS billing because of our decrease in calls right now.
I'm looking to see if Mr. Robbie, yeah.
Yes, this is Robbie. So the EMS billing, we do outsource the actual billing to a third party who does it for us, and it is a general fund revenue. And by council legislation, the billing rate is linked to the Medicare rate. It is not intended to be a full cost recovery. It's so we have it budgeted for $500,000 in the upcoming year. So, we more or less do kind of recognize it that it's kind of based on what we can collect. Again, we do bill. We are not heavy-handed though with the collection efforts. And in the overall scheme of things, as far as general fund revenues, it's a very small revenue. So it's not linked directly to the level of service. It's kind of that we're able to recoup as much as we can, but it shouldn't necessarily have a huge policy impact.
Thank you for that, because that was actually going to be my next question, was if we do see a major increase, where is this going to affect us going forward? So thank you, Robbie, for taking that. And Dr. Hill, you sent us a text message question about ALS and BLS. So for everyone watching, ALS is the term for advanced life support. So that's your paramedics and your people that can do advanced skills on the ambulance, more so than just start an IV or transport. BLS is your basic life support providers, EMTs, things of that nature. Okay, so it takes care of that. My last two questions. I'm thankful that you guys thought ahead to bring in a private ambulance to help with any load or volume, and I'm glad to see it's a local, so that's good too. But was there any thought to utilizing any of the ambulances that aren't on the street all the time, or backfilling maybe either through the foundation or even using the special ops people to fill in those spots before going to a contract?
Actually, Mr. Woods, there was, but I'll be honest with you, and I'd be less than honest if I didn't say it was a fleeting thought. At the time that we began talking about integrating the services, we knew that we would be challenged with personnel in trying to get personnel, and we also knew, or at least personnel with the right skill sets. So we sort of attached exigent circumstances into our plan. So had I had weeks and weeks to plan, it would have been probably a worthwhile endeavor for us to try and pull in some of our part-time, like hazmat and crew chiefs to work in a part-time capacity. But given this situation, that would have required making sure I had people available, trying to manage schedules. To be honest with you, in this case, going with the private sector integration, that became their issue. They provided the vehicles, they provided the people, they provided us a schedule. And to be candid, it took a little bit of weight off of my shoulders in terms of trying to plan. We were so consumed with PPE and a number of other issues that I thought this was the better option to exercise.
Oh, it's a great option. I mean, I can't tell you how many times in other regions of the country I've made the same call. It's brilliant because you don't have the extra overhead, you have the equipment, you have everything, you have medical oversight. So it's, and let's face it, I'm on the special ops team and I don't want to be on the ambulance. I'm a special ops guy. There's a reason I don't ride the ambulance as much as I used to. But the final question is the status of the mobile command vehicle and what's changes with that and how that's going about.
My understanding is the mobile command vehicle was placed on hold. That's the last progress report. We do have, we presented everything to the administration for review, and I believe it has been placed on hold for right now, sir.
Okay, thank you.
Thank you, Mr. Woods. Mr. Schroeds.
Yes, thank you, Council President. Good morning, Eddie.
Good morning, sir.
Yes, my question kind of dovetails in, I didn't know whether actually to ask it during your presentation or EMS or volunteer fire. So I'm just going to present it to you. I just wanted to see if you could kind of present a little snapshot of how we're dealing with that far northwestern corner of Harford County. I know that it takes a lot of time to get out to the scene with the paramedics, the ALS and such. It's been something I've talked about here for, at least the last 7-8 years. Because of course it was that that Fallston station was running in Narsville, and you kind of had Whiteford too, but it's just a really hard area to get to. Even though as the crow flies, Jarrettsville's pretty close. It still doesn't happen real easy. And I guess about 18 months ago, we were kind of given a heads up from the Narsville Volunteer Fire Company that a critical part of their team was going to be leaving, basically retiring and going south. And that was, like I said, a duo, because it was a husband and wife, and we no longer have them. So we're very limited on any type of, professional ALS support now that those two key volunteers have gone to more sunshine. So I didn't know if you could, kind of see what the plan is. There was a plan from a contingent of the Narsville Volunteer Fire Company that even discussed about pairing up with what they're doing in Southern York County. They thought that might be easier. It's kind of like it used to be. I realize that you have state boundaries there, so it's, I'm sure, a little complicated, but it is easier. For example, for a ambulance and a paramedic or chase vehicle or whatever to come from the Fawn Grove area at Citizens than it is sometimes to get from other parts of our own county. So I didn't know if you could help to paint a picture to see where we're going and what the plan is, especially now that we lost two key volunteers up there. So that's all I have.
Yes, thank you. That's an excellent question. And I have two answers for that. We did partner with Narsville in looking at their first plan. They spent a lot of time in trying to work through a number of solutions. And we worked with them, including the opportunity for dual reciprocity between Pennsylvania and Harford County, or Maryland, if you will, for their ALS and BLS skills and clinicians. I still think, the more I looked at that plan, though, my concern became is whether or not Southern York County would be able to be the end-all, to be-all answer for that. So while Narsville would pursue that, we suggested Narsville to pursue a secondary route by discussing with the the Ems Foundation on putting a clinician in their fire station. One of the challenges, as you know, that gets presented there is that that would be a full-time paid person to be there, but would the revenue and expenses balance out? So would their income be able to pay for those expenses? And that became a challenge. So we did encourage them to talk with the foundation, which they did. We asked them to come and speak to not only myself, but to Mr. Boniface and Mr. Glassman as well, so that we could collectively work on a plan to help them. Because even though we know EMS call volume in that area of the county is very low, it doesn't mean that the people there deserve less services. So to that end, they were working that angle, if you will, for lack of a better term. On the other side of this, I did have a number of discussions with Mr. Boniface, because he and I both believed that we needed upper end protection. How could we move forward with doing this? He allowed me to submit into my budget and ask for an additional 8 clinicians to be hired this summer if everything is approved, and also to purchase a third operational transport unit that would be placed in the field as well, and to begin looking at locations in the upper end of the county where this vehicle could be placed. So we have been looking basically in the Bush's Corner, Five Forks area of the county, trying to look for places where the county either owns property or we could find property and put an EMS station in that vicinity. Now, while I know if that is approved, construction will take some time, we are positioned to, again, pending the approval of this budget, sir, to hire clinicians this summer and to put those clinicians into an operating medic unit, transport unit, and station them in the upper end of the county to begin filling that gap and become that safety net. Now, in the interim, we will be looking and talking with the other fire companies for the potential of where could we house that unit. We do have a unit, or again, budget depending, budget approval pending. We will be able to purchase another transport unit this summer. But in the meantime, we do have a transport unit that's in reserve that we can utilize and place in service while the new one is being designed and built and then subsequently brought to us. That new unit, by the way, it will be, not a sidebar, will be a bariatric capable unit. Unfortunately, we have a growing segment, and I don't mean that in a funny way, a growing segment of our population who are obese and in some cases exceed 450 and 500 pounds. And there is a functioning bariatric unit in the county, but it's not as always available. And bariatric patients oftentimes will take 2, 3, or 4 hours to complete the transport, which is an undue stress on the volunteers. So our next unit that we're designing will be a bariatric capable unit. However, in the interim, we do have a reserve unit for when other units go down that we can put those clinicians that we hire this summer onto that unit and place that unit in the upper end. In the meantime, while this was taking place, this foundation and the Norrisville Fire Company, along with Mr. Glass and Boniface, they successfully negotiated an opportunity to put a BLS clinician in that station. And that BLS clinician is currently operating out of that station, so they can respond to a scene driver only and begin to render some form of pre-hospital care while they're waiting for the arrival of a higher staffed ambulance from either another mutual aid jurisdiction or from the county.
Thank you. And thank you, Mr. Boniface, and please thank the county executive. I know that that's been something that's been talked about and a big concern for many years, but it really didn't hit until 2 of our key volunteers have left. So thank you all for that. I'm just glad to hear that we have a plan moving forward to, like you said, Eddie, that, just because you're way out there, you still expect to get service, but it is hard to get those funds back. So I kind of like that area where you kind of pick, because they can do a lot of other things to keep them busy and not being way up all the way in that corner of northern Harford County. It's a lot easier commute from that Bush's Corner or area than it is from Jarrettsville. It's just too many country roads. And Whiteford's kind of windy coming up that 136, but it does seem like that area, that location that you pointed out would be a good spot. Thank you.
Mr. Schultz, that one other point, not to interrupt you, sir. We've been, the volunteer fire companies have been stand up as they always have. They've worked very diligently, and Boston Fire Company and Jarrettsville Fire Company have each increased their staffing levels to where otherwise areas that may have been caught in a void now have the ability to have staffed units. But the downside of that, and what increasingly comes with volunteer staff units where we're capable, is we get pulled into other jurisdictions, most notably Baltimore County. For example, in 2019, plus or minus, Jarrettsville responded probably over 100 times into Baltimore County, which pulls that resource into another jurisdiction. So anyway, all that by way of saying Boston and Jarrettsville, all the fire companies have, but most notably noting the rural areas of their communities, all those fire companies in the upper end have stepped up considerably to try and fill those gaps as best they can.
Right. And oftentimes, it's my understanding that when you're coming back from the hospital to Norrisville, it's such a long drive that you're likely to get called before you even get back to home base, and then you don't have anybody in your home turf either. So I think everything that you said is welcome news. I appreciate it.
That is a fear, yes, sir. With Norrisville, Jarrettsville, other rural companies transporting their patients to Upper Chesapeake, specifically Upper Chesapeake, it's 23 miles from Bel Air to Norrisville. That's a lot of ground to cover. And our model operates off the closest unit dispatch to the call. We dispatch the closest unit, and then we don't use AVL dispatching yet, but we do have the ability to see where all the ambulances are in the county. So once we dispatch the call, we then may see that another unit by vehicle location is closer, which that unit, if we assign that unit to that call, it's entirely possible that a unit from Norrisville could get hung up in Bel Air, Forest Hill, or anywhere in between on their way back home. So that does become, you're right, that does become a challenge.
Thank you so much.
Yes, sir. Thank you.
Thank you, Mr. Schroeder. Council members, anyone else? Citizen Budget Advisors. Director Hopkins, will you be still on with us? Excuse me a minute, just a minute, Mr. Tibbs. Will you still be on with us as we move through EMS Foundation and volunteer fire companies?
I'll be happy to stay on if you'd like me to. Yes, sir.
Would you please? Because we're going to, Mr. Tibbs, after your questions, we're going to go to Harford Community College and get Mr. Jackson off the slate before we move forward with our public safety stuff. So go ahead, Mr. Tibbs.
Thank you, Mr. President. Mr. Hopkins, on your line item budgets, I saw where the overtime and shift differential has increased about 40%. Is that because we don't have enough of people, or is that what was the reason for that?
It's overtime for both paramedics and the dispatchers is on the increase, Mr. Tibbs. We have dispatching is one of the hardest jobs to maintain people in. We are working very closely with administration at a staffing study as overtime grow it. But that's a challenge for us, is because we do often, because of sick call outs, people using their leave, we do wind up calling people in quite frequently on overtime to fill gaps in the dispatch. And also if we have large scale incidents where we need people because of the volume of calls. The same with the paramedics. The volume of calls for paramedics, because we have 16 paramedics and 2 ambulances, and trying to give them time off when they need it, or time when they run, calls run longer than normal, or sick call outs, maternities and things like that, we do end up spending a lot of overtime money for paramedics as well. So yes, they are both on the increase. A lot of it has to do not only with a need for increase in staffing, but also with the need because of the increased volume of calls for service.
Would it not be easier to harness maybe one more person or 2 more people? It would still be less than what you're speaking of here.
Yes, sir. And that's where I'm hoping that this summer, as our EMS service grows, we'll certainly have a larger pool of people to pull from. So with 16 paramedics, we're limited. But when I think when we get 8 more on this summer, if that's all approved, we'll have a larger pool to pull from. We also, working with Mr. Boniface, we developed a part-time program as well, which we've not realized the full effect of it yet. And this part-time program has allowed us to hire 2 additional paramedics part-time to fill in those gaps. So for example, instead of keeping someone over right now, the way the contracts are, I can keep paramedics over an additional 24 hours beyond their first shift. If that happens now, I can actually go to a part-time person who, if they're off work and they can come work for us for 12 or 24 hours, I'm paying them a part-time hourly rate rather than an overtime rate for a paramedic. So the gap filler for me until this summer, and I'll even keep those 2 part-time people on, potentially ask to hire 2 more, will be to fill those short-term gaps or those small gaps that we have. In terms of dispatches, we are in the process of interviewing candidates now to fill the vacancies that we have. And we do have, I don't have it in front of me, I apologize, sir. We do have a plan for going forward over the next several years as we take a look at the cell phone revenues that are coming in, for the ability to grow the department and maybe to have those expenses covered by the cell phone revenue that's projected. But we're barely into the first year of those projections. We don't have good numbers to see what that looks like quite right yet.
Thank you very much.
Thank you,
Mr. Tibbs. Thank you, Director Hopkins. I'm sure we'll ask you a couple of questions moving forward. Just bear with us a second.
Certainly, yes, sir. I'll go on mute, sir.
Thank you. Next, Harford Community College. Mr. Jackson, if you could unmute your mic, that's great. I want to apologize for any confusion there may have been this morning to get you on board with us. What I would like you to do before you speak to any questions we may have for you is just give us an update on how the transition is going at college.
Absolutely. And good morning, council members and President Vincenti. We are under a big transition at the college right now. The Board of Trustees have begun their onset of search for our next president. In the interim, we have Dr. Jackie Jackson serving as our interim president. She's been doing an admirable job in light of the pandemic and everything that she's been asked to do in these very uncertain and unique times. We're in the process of some of those other higher level key administrative positions. We're well on our way to filling those positions with our Director of Finance and our Associate Vice President for Human Resources. We're anticipating having those one filled perhaps within a month and the other one the month thereafter. So we are rebuilding right now, but we are still progressing forward with all our initiatives as we had them in place, reevaluating all the initiatives that we were doing prior to Dr. Phillips' resignation. So we are still moving forward, and again, in light of all these difficult situations.
Thank you for that update. I appreciate that very much. Council members, questions for Mr. Jackson in reference to the college? Seeing none, citizen budget advisors? Mr. Jackson, you still have a couple renovations moving forward there at the college?
We do, yes. We're still planning on moving forward with the Chesapeake Welcome Center. That is that's our highest priority right now. Our Board of Trustees just last month approved the construction manager at risk for the project. So that is for pre-construction services. We're still in the final stages of our architectural services that we're securing as well. We anticipate, aside from any kind of state funding disruptions, kicking off the design of the Chesapeake Welcome Center probably sometime in mid-July.
All right, very good. Well, thank you for that update. And again, I apologize for any confusion this morning. Thank you again.
You're very welcome.
Council, I believe next will be our volunteer fire companies. I see Mr. Duza is with us and Mr. Ayers was with us. Good morning, gentlemen.
Morning.
Good morning, Mr. Duza. Will you take the lead here, sir, or will Mr. Ayer take the lead?
Let me defer to Rusty if he wants to start. Otherwise, I have some statements for us.
All right, thank you very much.
I'll let Bill go ahead because I'm actually using my cell phone at work, so it's a little bit more difficult for me to use that technology. So I'll let Bill take the lead, but I do want to thank you for everything you've done. County Executive Director of Administration, especially DES, has worked very closely with us, and I feel we really have a great partnership with them. So I want to, express my thanks about that. And with that, I'll let Bill take it.
Thank you very much, Rusty. Bill, I want to appreciate you taking the time to speak to me yesterday. And Mr. Duza, hold on just a minute. Ms. Dixon?
Mr. President, I just wanted to verify, we have a user and caller that is unidentified as caller user 6. They may be with the foundation. Did you want me to check that before you proceed with the schedule? I believe they were next. The Ems Foundation?
Yes, that'd be fine. It may be Miss Worthington.
Hi, caller user 6, can you identify yourself, please?
I'm not sure if I'm 6, but this is Lisa Norton with the foundation.
Yeah. Yes, I do. Yes, you are caller user 6. Okay. Mr. President, I'm not sure how you wanted to proceed. The Ems Foundation was next. She is the only one that I see on here.
I'm sure she won't mind waiting just a few minutes as we get through our volunteer fire companies now that we've opened that up. So, Mr. Duza, if you would please go ahead and continue.
Okay. Thank you, Council President Vincenti, council members. As you know, in November of last year, we provided a detailed briefing of our fire service capabilities and also our needs. Obviously, that's been changed. We're in the short term now dealing with the COVID virus emergency. However, the long-term outlook looks pretty much the way we described them. Our plan is to continue to provide our citizens with excellent EMS and fire service while we're ensuring the safety of our own people. We'd like to thank the county government, especially the Department of Emergency Operations and the IT department for their support during this emergency. They've provided the capability for us to continue to work as a group. Without the IT services support, we would have had a lot of difficulty since we're 12 different organizations that work together. We'd also like to thank County Executive Glassman for the planned increases in our operations, capital, and LoSAP funding. In addition, we'd like to thank him for the increases for the foundation, which will also help our fire companies. All of that said, our biggest concern is future staffing for fire. We told you in November. In the years to come, we're likely to need some additional funding to entice our volunteers and to augment their overall staffing. With that introduction, I'll open it to any questions.
Thank you, sir. And again, Mr. Iyer, anything you want to add before we move forward with questions?
No, thank you. I think he covered exactly what we need to say.
Okay, thank you. Council members, any questions for Mr. Duza? Mr. Woods?
There he goes again.
You
Just
looked
automatically assumes. Thank you guys for coming out. The one question, I don't know if you were in it when I asked Director Hopkins, was about EMS billing. Has there been any indication from our member companies that show with the decrease of EMS responses what this might do to our overall budgets across the volunteer service for from EMS billing projections?
Councilman Woods, all I can tell you is in the short term, obviously, since I'm a member of Abingdon, I watch Abingdon's EMS income, and actually ours hasn't decreased significantly. So while I think there's a dip in the last couple of months, actually primarily the last month, I don't believe it's going to have a long-term effect. So I think overall, I think our ambulance billing is going to remain fairly stable in the long term.
Yeah, that's what I was hoping to hear. I'm thinking that my worry is in case we do take a larger dip, if we need to rethink of how the budget's working, or if we can handle it internally in each department. With everything that's going on, I know obviously for Falston, they've done an outstanding job with setting up distancing and decon stations. I've seen some other counties that have made some decon stations at centralized locations to make it easy for their departments and everything like that. From the association aspect, how has the coordination or working through each department going with that for you guys? Have you worried, is everybody doing their own thing, or are you guys kind of pulling it all together and making sure everybody's at least on the same page or working together here?
Thanks to Colic Chair Rudy Walter, we have a meeting every Thursday night with the leadership from all the companies. So we're actually, at this point, probably more unified than we had been, because we had been having, we typically had our monthly meetings. Now we've been doing it on a weekly basis. Rusty Iyer usually provides some guidance. And as far as I know, all the companies are following the same general rules of masks in stations and all the things that MIMS has been providing, as guidance for us. So I think that we're actually very unified as a group, and I think everybody is following the general guidelines from the association.
The northern end. Actually, let me back up. All right, I'll get into LoSAP. Obviously, the LoSAP changes with increasing the $25 to the members that are already in there. I still have the list of all of the other requests that have come across from the association back all the way from 2014, 2019, including things like changing the age, the cap points. I know for Falston, there's a lot of members that are admin critical, but we're not allowing them at the station right now. And it's going to become an issue with collateral points for them to maybe even finish up their year. Is there any other departments that are seeing that as an issue? Are you guys feeling that at Abington or any others? Because I think it's something we really need to address sooner than later.
I think you're right. I know the people like the board of directors and some of our subcommittees have been meeting electronically. However, there are probably people, obviously that do the funding, the fundraising support and stuff like that, that may have a shortage of points by the end of the year. So you're correct. That may become a problem.
Yeah, I think if we look at the increasing the collateral duty cap to 40 points, that might be able to take care of those problems for those guys.
Yeah, and I think as we have from the information from the county auditor, I don't think that would have a significant increase in the overall cost of the LoSAP program.
Now, from the 2014 actuary study, which obviously is old, it says there was the minimal impact with that one. The governor's order that came out that allowed clinicians and to bring their certification back online. I know a handful of people that have brought their EMT and ALS certifications back online. Have you seen an increase of that across the county?
We do. Yeah, at Abingdon, we have 3 people that have gotten their certification back and are coming back to support us. I can't speak for other companies, but I know for a fact at Abingdon, we've gotten 3 people back.
Yeah, my wife, she got hers back too. And see, Director Hopkins, there you go. If it's within 10 years, you could be a paramedic again. Look at that. Collateral points. All right, if anyone else goes, I think I.
Thank you, Mr. Woods. Council members, anyone else? Seeing none. Mr. Duza, I know that there's a partnership coming with Harford County government and I guess the Abingdon Fire Department to put the new house down off of 543. My question is, I do understand it is going to be built to house an engine as well, or a truck as well. What piece of apparatus do you see envisioned for coming there?
It's difficult for me to speak for Abingdon Fire Company, but ideally, one of the pieces of equipment that we could move there would be the rescue truck, since it has direct access to 95. Currently, the rescue truck is at Company 4 House 1, and it has a fairly significant run, excuse me, either to north to 543 or south to 152 to really get on the highway and respond. So ideally, I think probably moving the rescue truck there would be a good piece.
Thank you, sir. Any other council members? Budget advisors?
I did find my other question.
Mr. Woods.
Thank you, Mr. President. I'm sorry. I knew I had one more line of questioning and I lost it in my pile of stuff here. Before all this COVID happened, we were in talks with the school board and with some of the members of the association to really change the cadet program and bring in more school involvement. And the superintendent, I just want to let you know, I met with them recently again. They're all very interested in expanding and seeing how that helps with the new criteria that's set within the Kerwin Commission. I just want to make sure that once all this settles down a little bit, that the association will still be receptive to that and that we can leave off or pick up where we left off, because I think if one of the things that's going to help us, the cadet program helped us tremendously. I think if we can expand that to all grade levels in high school and be able to use it as a bigger recruitment tool, is going to pull us through some major staffing issues coming up in the future. And I'm just hoping that we get full support across the association, and MIFRE is of course very supportive of moving forward with that and upgrading it. And I'd like to actually from the association be able to put something together sooner than later to steer the school board in the right direction of doing that. So.
Well, I agree. Chief Cox and Rhonda run that program pretty much, and they've been very active and they've kept us apprised of what they'd like to see in the way of changes. So the association is very supportive of that program. they've done a good job so far, and it would be great to see if we could expand it. It would really be great if we could make it a true career opportunity for the young people as they get through the end of high school.
Absolutely. My ultimate goal would be if a 16-year-old can get in the program, come all the way through. If I look at myself. By the time I was 21, I was already in officer training. Fire officer 1, 2, 3, and I was very lucky to be able to take every class I could. I started EMT at 15, finished it on my 16th birthday. So that was a game changer for me. And I know it could be for tons of students, especially if the school system would recognize letting them in at 16 when we do. And then the follow up with that, to be able to work with our college, to be able to take those credits and be able to put them into an associate's degree path as soon as they graduate from high school. I think that's going to help us tremendously if we can make that happen in the next few years. But I want to thank you for that support and all the other support you give us.
Yeah, that would be great, and it also may address our paramedic shortage. If we can get people started down the EMS path in high school, they could come out with prepared to be a paramedic and have a job very quickly.
I agree, and I would much rather hire these students from Harford County than taking them from other counties around the state. Thank you.
Thank you, Mr. Woods. Anyone else before we go? Bill, Rusty, appreciate all you do, guys. Thank you very much.
Thank you, Council President.
Next, we will have Ems Foundation. Lisa, are you still there?
Yes, I'm on.
Anyone else with you?
I'm not sure. Jason, are you in?
Yep, I'm here.
Mr. Gullion, how are you?
Good, how are you, sir?
Good. Go ahead and proceed. Just if you would, again, just kind of give us up to date with how you guys are working within the COVID virus, and then anything that you would like to add before we open up for questions.
Lisa, if you want to address the COVID stuff, I'll cover the budget.
We've made some changes in the way we operate, obviously. Everything seems to be going video conferencing or telephone conferencing. That's how we're staying apprised of everything. We did make some changes in operations, which was budget neutral. So we've got 2 primary operations supervisors in the office, and we're using the supervisors, field supervisors assigned to Paramedic 13 to function overnight, and Paramedic 14 is being shut down at night. I think that's probably it.
Thank you.
For operations.
Go right ahead, sir. I'm sorry.
So to just kind of expand on what Lisa was just saying, that was something that was in the works previously to realign our management and supervision for some better oversight and bring span of controls in line with acceptable standards. It kind of caught us at the beginning of this pandemic and has been beneficial so far, working some kinks out on that. In regards to the budget, I'll hit through some of the highlights here. The BLS providers for company 1, 6, 9, and 13 at $275,000. That's to add providers to those stations to have a complete BLS transport crew. So that would bring us up to 2 providers per shift, so that at minimum they can transport at the BLS level. The what had previously been just the chase cars, we're transitioning them to supervisors that will still be providing the ALS support for those BLS units. The next line down is $25,000. That's offsetting some costs for Jarrettsville. In the past budget year, they had added an ALS provider 24/7 to their company. That is offset some of those costs. In order to afford the BLS providers and the stations for the companies, we had to kind of shift our reimbursement rate, which had previously been 65-35. We had transitioned it to a 50-50 split, the company paying 50% and the county paying 50% of the cost of the in-station personnel. This is still potentially taxing to some of the companies. Every company benefited from this but one, and I believe that was Falston, and I believe it was only about a $2,000 or $3,000 difference that they would be paying extra. So this is in general, it's benefiting the entire county at the company level. The next line, the $355,000. Historically, the ALS support or chase vehicle had a daily usage fee associated. With the change for companies 1, 6, 9, and 13, there really was no way to even guess what the usage would be to set a fee for that. Plus, if the companies were paying for that, it also could be prohibitive for them to afford the second BLS provider in the station. So we requested additional funds so that the 3 ALS supports or chase vehicles supervisors would be covered 100% by the county. And the last line was added to provide a BLS provider at Norrisville, so they have a driver up there to get their unit out and be upgraded. They've had some recent changes up there that have left them short on manpower.
So you're saying that's going to provide a driver that whoever took the unit out would be by themselves?
They would be doing the same thing we had previously done with 1, 6, 9, and 13, where they will go out driver only, and the paramedic 6 or 13 would then upgrade them as needed and support them. Unfortunately, the call volume up there really doesn't support having staffing in the station to the level of the other companies.
Okay.
So at least get a body to the patient as quickly as possible.
And just so you're aware, the driver only would be an EMT who would have the capability of starting basic care until the upgrade came.
Understood. Anything else?
I believe that was everything that Executive Glassman had forwarded to the council. I just wanted to touch base on those lines and didn't want to tie up too much of your time.
All right. Thank you very much. Council members, anyone for questions? Bring that up. I need a screen up. Can't see. Bear with me a second. Sorry, I couldn't see. Anyone with questions, please? Seeing none. Citizen budget advisors? Seeing none. Thank you both very much. I appreciate it. Do we have anything else for Director Hopkins before he goes? Thank you, sir. Appreciate it.
Thank you, Mr. Council President.
Thank you.
Okay. All right. So it sounds like we are moving fairly quick, so we're going to take a pause. Ms. Dixon, I don't know how you want to handle that, whether we want to reach out to the sheriff's office and see if we can get them on quicker.
Sam, actually, I've been in communication with her, and we're trying to reach them now.
Okay.
Mr. President?
Yes, Mr. Boniface.
I do have Kathy Burley here if you want to slide her in, but that's up to you, sir.
Yes, that will work just fine. Thank you. Good morning, Ms. Burley. How are you?
I'm good, thank you, Mr. President. How are you?
Very good, very good. Again, we've been asking everyone just to kind of give a brief update of how you've been moving forward throughout the COVID-19 pandemic. And with that, anything else that you add before we open up for questions?
Okay. First of all, thank you, Council President, County Council, and Budget Advisory Board. It's my pleasure to be here today. The coronavirus has given us a lot of new challenges that I feel like my staff has really stepped up to the plate on. We have had to close while our parks have stayed open, and we are really become the go-to for anyone looking for any kind of exercise outside of their home. We have had to close playgrounds and basketball courts and one park, all because people were not handling the social distancing at those entities. Our recreation staff has done a fabulous job. They've moved to online programming. So we do have a whole new section at home with Parks and Recreation. And they're doing a good job filming some activities, giving people at home some things that they can do also from their place. We have been in touch with the Rec Council presidents. They have a lot of cancellations they're having to deal with. Bel Air Rec Council and Emerton Rec Councils are the two rec councils I know for sure that have finally said, yeah, we're not even going to try to bring the spring sports back. Bel Air Rec has now refunded over $120,000 worth of registration fees. So it's a big deal. It's a big hit on those rec councils, and we're going to continue to work with them moving forward. And then our maintenance staff has been essential. They have been coming in. They've been working our ball diamonds because if we don't work those, they kind of go to pot, for lack of a better term. We need to keep those maintained. And then and other work around the county. Our trails have seen more use on a regular basis than normal, and so we have some issues there that we've had to address as well. We have instituted some things to make sure, though, that they're protected and social distancing is used. We have limited to one per truck, that type of thing. So even for trash, we do have a chase truck going out with the trash to make sure that we get it done, but it takes more than one person. And with that, I think I'll go ahead and open it up for questions.
I didn't hear. Did you mention Cedar Lane? If not, can we get an update on that? I know there are quite a few improvements going on there.
Cedar Lane, there are improvements going on there. We had 3 of the natural surface fields recently regraded and grassed, and those fields are looking amazing. Actually, all of our fields around the county are enjoying this rest at the moment as they are not having use. And if we could have every spring with this little use on it, our fields would be in really good shape. But back to Cedar Lane. So we've done those fields, and we have plans moving forward to replace the existing turf field that's there, and then to add a second turf field there to also alleviate some of the cancellation concerns we've had in the past for major tournaments coming in. The turf fields give a lot more flexibility to those concerns.
Very good. Thank you. Council members, anyone with questions for Ms. Burley? Mr. Johnson?
Good morning, Ms. Burley. How are you today?
Good morning, Councilman Johnson. I'm good, thank you.
Good to see you again. I just have a couple questions. Rec Council activities. It looks like there's 181,000. Could you talk about Rec Council activities?
The Rec Council activities, we work with the Rec Councils, and we pay for custodial services in the school system. And we handle that through our joint use agreement. We handle the payment of those services, but then we bill those services to the rec councils for reimbursement.
Okay, so could you explain the relationship between Parks and Rec and the Rec Council? Because I think people don't understand that.
Absolutely. Our rec councils are a very integral part of our department. However, they are also at the same time very separate entities from our department. They are 501c3 nonprofit corporations that operate. They have a board. They operate their own programs. In essence, they are, when you think of a lot of the Parks and Recs activities, the leagues, the ball games, that type of thing, those are usually run through the rec council. The rec councils work with us. They utilize our facilities, so our fields as well as our buildings. They get priority use of those facilities as long as they meet the requirements that we set to be a Parks and Rec council.
Very well, thank you. And recreational services, what it looks like $3.2 million was budgeted for recreational services. Could you explain that?
Recreational Services is our division of our department that handles a multitude of things. First of all, there are building managers at our facilities, so making sure the buildings are operational. We have recreation staff that is a liaison to all of those rec councils. So every rec council has a Parks and Rec liaison. That staff operates out of there. Out of our rec division, they're rec specialists. And then our rec specialists also, and this is an area we've been ramping up since I've come on, we also do our own programming to fill in the gaps where the rec councils either may not have the time, energy, resources, or interest to provide certain kind of programming. So an example might be we do some homeschool programs. Because most of the rec councils, a lot of those volunteers, they are mostly volunteer. A lot of those volunteers work during the day. So they are not home, they're not available to provide homeschooling classes. So we have been able to step in and fill that void, and that's been a very popular program for us.
Thank you. And I just have one final question. And this is a smart aleck question or anything. The question is that going through the budget, and maybe it was a typo, but it said it says about the Emerton rec and tennis court. I guess there was a capital project done, and it said that that I guess it was supposed to be built in 2015. Has that been built, or is it still in the process? Or what? Could you explain that?
You get this room C plan for 2015. Yeah, I think we have a fitness center and fitness room in that facility, so I'm thinking maybe that was a typo.
Thank you. And finally, could you send a list of recreational programs from the Edgewood Johnstown area for me, please?
Now, are you speaking of the rec council programs or the programs that are run by our rec staff?
By your rec staff.
Okay. Yes, I'll be happy to do that.
Thank you so much. With that, I thank you for your service and I appreciate your dedication. Thank you very much. That's all, Council President.
Thank you, Mr. Johnson. Mr. Schroeds.
Thank you, Council President. Good morning, Kathy. I just wanted to see what the status was in Jarrettsville, I guess kind of known as the Preston property. I see a lot of kind of changes there. I realize that you're moving some offices there and using it a lot more for storage. But of course, I see in the out year that it's still proposed, I think, 2023 for an activity center and design money, I think, in 2022. I realized that that sort of funding, it's in competition with other areas of the county, but there still is a need, and I still hear it a lot that we do need that. But until then, as you know, there is a beautiful pond there. There's been talk in the past about a meandering trail that would kind of encompass the pond and some of the property, even along with the pavilion. So, individuals that don't have access to that type of recreation and facilities to get together. I realize we have one at Eden Mill. We have these pavilions around. Northville Elementary has a nice pavilion. They're used quite a bit, but I just think that one in Jarrettsville, until we actually get the actual activity center, that property, can still enjoy a lot of use from the public. I've also, it's been a little while, I guess it was last year, I was hearing from some constituents about the Friends Pond kind of getting filled in with sediment, a lot more growth, and a lot harder to fish and to really enjoy that facility. And I think that it seems like the pond at Jarrettsville seems to be much cleaner, clearer, a lot better maybe for fishing and other recreational opportunities. Friends Pond is becoming more of a turtle pond and a frog pond. So I don't know if you could just speak
Absolutely.
to that.
Well, you kind of stole a little my story. We are looking at, we're not waiting for the building to put those other amenities in. We are looking for doing the plans to do a walking trail there. We had a master plan done of the property to kind of identify. So we didn't want to put, say, a pavilion in where the building was going to go. So we kind of have an overall plan. We do have we aren't in the process. We moved our rec services division out to Preston property. So their offices are there in that main house. And they're also have already started doing programming out of that house in January. So we're doing some preschool programming. I think we have some homeschool programming out of that as well. We do have some fun things planned if we can get out of this lockdown and get on. We do have some fun things planned for the fall, some that center around the pond. We do work with DNR, both at the Friends Pond, and we are to talk to them about this pond, about looking into the possibilities. Friends is stocked, but we're also looking into seeing what the possibilities at that pond would be as well. So we are looking at that complex, that area, to get some programming out there at the very near. More programming, because we're already there, but to get some outdoor programming going on there as well.
Great, thank you. I appreciate that.
Of course.
Thank you, Mr. Schroeds. Council members, anyone else? Budget advisors? Mr. Ondish.
Good morning. How are you? Do we have any of our rec councils that have property that they rent or that they own, that they have payments that they'd have to make during these times?
There are definitely rec councils that rent some indoor space. Some will rent from churches, that type of thing, that might have a gym. They obviously, anything they rented during this time, they're not utilizing, as everything indoor got shut down. I can't swear to you that they don't have something they own that they're making payments on, because once again, they don't make all that, they don't have to make all that information available to me.
Sure. And then when you touch on the registration fees, and I know you threw out 180K, what what impact is that going to have across the board on all those? Because I don't believe all of them are sitting with these balances that are going to be able to help them through this. Is that something that when you say we're going to work with them on, what do we specifically mean?
Well, we don't know yet what we mean by that. We're still kind of gathering the information. For example, Bel Air Rec Council, it was $120,000. But in that process, they're not having to pay ref fees for this season. They may or may not have ordered uniforms for this season. So some of that money is kind of money in and money out. So we are planning, we do meet with the Rec Council presidents virtually now. And I'm looking to ramp up those meetings, maybe have another conversation. I wanted to see what restrictions were going to be lifted, when type of thing, when the governor spoke on Friday to have. So we're looking at hopefully next week having another conversation with them and to see where they are as far as the refunds. And I don't know, I guess is the answer to that question.
I mean, I think it's a logistics nightmare, and also moving into, fall sports at this point, summer sports. I mean, are we trying to have these councils hold off on anything until we specifically know, just for, I mean, like you said, if there's things that are ordered, that's all money that's now gone. And I know a lot of that comes from their own fees that they have, but have we given any guidance we don't know when they're going to open back up. So are they kind of slowing down until we get better guidance?
Different rec councils are doing different things. Some have said, yes, we're going to go ahead and take the registrations at this point for fall soccer as an example. Other ones have said they're holding off. For us to give them guidance would once again be telling them kind of how to run their business. Sure. So we kind of shy away from that. However, we certainly are working with them, and as soon as we have an idea of when we think things might open up, when we might be able to make our facilities available to them again, we're having that conversation.
I think the reason I'm saying is I think we're going to have a concern if they continue to take in money and use those to pay expenditures, and then the refund process. And I've been in one, and I'm not sitting here to bang on their door. I mean, if I don't get it back, I don't. But I do think that's going to fall back on your office, because there's going to be a lot of people that reach out to the county when these refund policies don't necessarily work. So I don't know where we are with that now. It is early. I just think that's kind of where my concern is with this. So thank you very much.
Understood. Thank you.
Ms. Hergenhot?
Yes, Kathy. Will Parks and Rec sustain any financial loss with the 501c3 Department of Recs other?
Well, the rec councils, they're separate, so we won't see that loss. But as far as our revenue for Parks and Recreation, for example, the Rec Services division that Andre was asking about, they were on target to be bringing in $120,000 this year. And before refunds, we were at $80,000. But obviously, camps are a big item in our world, and we still don't know where we're going to be with camps. And even if we are able to hold camps, I think the numbers that we're going to be able to put into camps are going to be greatly diminished. So then we have the Emerton Rec and Tennis Center. We've had to refund all the block time money for that. We've had weddings at Swan Harbor Farm that we've had to refund those weddings. A lot of them have moved to other dates, thankfully, but we have offered that as a refund possibility.
And speaking of Swan Harbor, is that run as self-sustaining with weddings and other events? So is the cost of renting Swan Harbor by the end user pay for the use of Swan Harbor for to keep it up and running for the whole year?
Those funds do go back into the Swan Harbor Farm account, and we are moving in that direction, yes.
Currently, it's being subsidized by your budget.
Yes.
And I'm sorry to bring this up, but I would be remiss if I didn't share Miss Moon's concern about the senior center in Joppa. And it's nowhere listed in the budget or capital plans. I know that if Ms. Moon was here, that would be one of her points to bring up, that that area of the county does not have any plans for a senior center. And I just wanted to give her 2 minutes of fame so that we did talk about a senior center in Joppa. Thank you very much for all you do. I know these are unusual circumstances.
Understood. Thank you.
Mr. Tibbs.
Yes. Ms. Burley, I just wondering, with the closing of the Aldina fields, has there any thought been given to maybe using some fields temporarily until this Perryman fields open up? I know it's going to be a while before they get open.
That is part of the reason that we have invested some more funds in at Cedar Lane sports complex, was to bring those fields up to a higher level. And that's also one of the reasons that we looked at putting a second turf field in there. While it does not replace all the fields that were lost there, it assists us with that. We've also are working with Cedar Lane Sports Foundation to utilize other facilities, not totally dedicate other facilities, but utilize other facilities to get him the fields that he needs for tournaments.
Thank you.
You're welcome.
Thank you, Mr. Tibbs. Along those lines, Ms. Burley, has there been any thought for any temporary use for any fields anywhere else in the county?
For the Cedar Lane sports tournaments?
Well, just like soccer or lacrosse fields temporarily while we are down with Carson's Run.
I'm still not sure I quite understand the question. So we have fields that, go ahead.
I know that we've been approached by some property owners throughout the county offering up different sites for temporary use. And I was just curious to see if anything has moved forward with any of that, or if we're just going to go along with Cedar Lane until any new facility is built.
Well, Carson Run, as you know, was not our facility to begin with. So we have worked with Cedar Lane. We have fields that during their peak season are not being used around the county. They're not all necessarily in one drive-in and park site and hit 12 fields. But we feel confident that we can assist them with, it's a Band-Aid until other fields become available, but we can assist them with having fields to make use for their tournaments.
Okay.
Oh yeah, and some of those fields that we're working with the Harford County Public Schools to utilize some of the sites, and we think we can get a decent number of fields at some of those sites, some of the larger complexes where there are multiple schools in one area.
Okay, thank you, Ms. Burley. Anyone else with questions? All right, seeing none, thank you again, Ms. Burley.
Thank you.
Council, at this time, it's our pleasure to welcome our Sheriff Gaylor, and his team at the Sheriff's Office. Good afternoon, gentlemen, or morning, I guess, still. Can you unmute yourself, sir?
Now.
Got you now, sir.
Okay. We had the phone dialed in as well. So good.
You okay now?
Okay. We're doing a little technical rearranging. Can you hear me now?
Yes, sir.
Very good. Okay, we're off. So, Mr. Council President, council members, thanks for your time this morning, and we're good to go. How would you like to proceed?
Just like everyone else, sir. I mean, I know some of the things that your office has done to make changes during the COVID-19 pandemic, but I'd like you to touch on that. I'd like you to touch on our crime numbers, if you will, And then anything else that you would like to add before we move into questions from council members? I know you've done an excellent job with a lot of your social media posts, keeping the citizens up to date. But this would be your time here at the council office.
Absolutely, thank you. I'll start off with the fact that unfortunately we haven't dodged the bullet here at the sheriff's office. We've had 7 of our employees test positive for COVID-19. I'm happy to say that all 7 are back to work effective today. I think the last one came back today. 6 law enforcement deputies and 1 civilian staff member at the detention center. Knock on wood, we are fortunate that we have had 0 incidents in the inmate population at the detention center. Our healthcare provider at the detention center, Prime Care, they did have 2 of their employees who work at the jail routinely test positive. In fact, we believe one of the 2 cases there is what led to our civilian staff member at the detention center also being exposed. We, like many other places, have taken many steps to either deal with it if we get it, but hopefully prevent the virus from making it into our ranks and at least having a severe detrimental impact to our operation. And knock on wood, so far we've been very successful with that. First and foremost, which everybody's doing the social distancing, the constant reminders of washing hands and disinfecting, cleaning incessantly behind yourself and behind our employees. So many of those same steps that other people have taken at the detention center. I have a 2-page list. I won't go through every single detail, but at the detention center, to try to keep it from getting into that population, to our workforce, or into the inmates any more than the exposure we had. We have, of course, cut all programs and all visitation. We have had to work with the courts, at least direct the inmates to work with the courts, those who are serving weekend or sentences. And we've gone from somewhere in the 50s number of weekenders, people who are reporting to the jail for weekend sentences. As of this morning, we have only 8. And those 8 are 8 individuals who decided of their own that they don't want to work with the courts or through their attorneys to shorten their sentence, that they wish to get their sentence completed. So those 8 are going to serve their weekends, coming and going from the facility. Overall, the jail population today was at 260. That is, according to the major up there who's been here for 20-some years, it's the lowest jail population he has ever seen. Obviously, I'm happy to say crime has come down somewhat in this COVID time period. Arrests are certainly down. With courts closed, less people, pretty much no one's being sentenced at this point. All these factors driving our jail population down to a very low level. Hopefully that also helps protect us. We put many steps in place. Every employee is screened coming to work. The contractual employees are screened coming to work. No vendors are allowed to deliver into the building. And any inmate that's brought in through booking is screened in. We have a housing unit, which we haven't had to make use of yet, in the new section of the jail, reserved as an infirmary should it become necessary. Knock on wood, I'm happy to say that's still not the case. But new inmates, before they are put into general population, are held in a 14-day part of the facility before they are put into general population to make sure that no symptoms develop. And then, again, one of the steps to keep it clean. When they're in that 14-day transition housing, their temperature is checked twice a day by Prime Care. The entire facility is checked once a week. Every single inmate, the temperature is checked once a week. And we are so far very fortunate. Unlike I've heard from the Department of Corrections, some of the problems they've had in their facilities, I think we've taken a lot more steps and we are a lot smaller scale, and both of those things have worked in our favor. We have had to look at, with our workforce, processes that we've put in place should we have, and of course we put them to the test because we have had those law enforcement exposures of how long we put these people out of the workplace, if they have an exposure, or then once they're confirmed, and what does their return to duty look like, and the contact tracing behind each of these incidents that we've done, working in concert with the health department, the Department of Emergency Services, to go back and try to establish a path for these individuals to see who else might have had an exposure. Again, we've been very fortunate. Other than the 5 of our 6 have been criminal investigations division, and the other one was temporarily assigned to special investigations division. Really thought this, if it hit us, it was going to impact us in the patrol force, but it hit us in our investigative services first, and put a few people out of work for a few days. But we've made it through there, and hopefully we've dodged our bullet. But I think we all agree we're a long way from being completely out of this. The other thing I should touch on is the executive orders that have come out from the governor's office. The stay-at-home order, which is essential business. We have worked with the state's attorney, Mr. Peisinger, with the allied law enforcement agencies, Bel-Air, Aberdeen, Harry Grace, and the state police. I don't know if you've heard or what the word on the street is. We get the inquiry every once in a while, and thank you for your compliment, Mr. Council President, about Christy Hopkins and our Director of Media Communication and our social media messaging. We hope we've pushed out all the right messaging. Some people just aren't getting it, but we are not out there pulling people over in the middle of the day or in the middle of the night to see if they're in violation of the governor's executive order, stay home. If you are stopped for something else, we're still out there looking to remove incapacitated, impaired drivers from our roadways, or to lock up criminals, which we have also done. Those people obviously are not staying home or moving for essential business. We've only charged 2 individuals who were breaking into cars in the middle of the night for, in addition to charging them for breaking into the cars and stealing, we've also added a charge after consulting with the state's attorney for violating the executive order. The next order was the crowd capacity started off at 50 in large events. The governor reduced that to 10. We are responding to those or essential businesses that are supposed to be closed. If a call comes in, we are responding to those. What we have set up there is a call screening process working with the Department of Emergency Services, because of course that's where call taking is and that's where dispatch is. So any caller that calls 911 is routed through a series of questions, whether it's fire, EMS, or police. They go through a series of questions to see if it's a location that has a confirmed COVID case or a person under investigation, a PUI. And that way our law enforcement or our EMS, county EMS providers know what they're dealing with before they get to the scene, and they have the ability to don the proper PPE, if personal protective equipment if necessary. From there, the calls are being directed to our telephone reporting unit. We've taken with schools closed, we've taken our school policing deputies and our community policing deputies, because we're really doing no community events, obviously. And we've stood up a telephone reporting unit in addition to helping the schools with the lunch distribution. So the telephone reporting unit then makes the calls to the businesses, and we're doing the same thing now with the mask order. If we have a complaint that comes in, we try to contact the business to see if it's operating in violation, or in a mask case, if someone's in there without a mask, and if they want them removed. If that is the case, then we respond on a trespass, not on a violation of not wearing a mask. Essential businesses that are told to close and do not, or businesses who don't make their employees, when they're dealing with the customers, the retail businesses, the restaurants, wear a mask. Those are referred to the health department for the enforcement. So all of that, I think, I probably missed some other things, but that's kind of where COVID has hit us and changed our operations at the sheriff's office. I could probably go on another hour, but I won't bore you with that. But I would go, Mr. Council President, you asked about our crime numbers. Is it good to go into that, or any questions on our COVID stuff?
No, I believe you should just move forward with your crime numbers. Yes.
Very pleased that the wrap up last year, we saw a 16% decrease overall in our uniform crime reporting numbers. Uniform crime reporting numbers, of course, is the FBI program, UCR. It's been around since the 70s, and it's how crime is tracked. I always speak of it as a sheriff or police chief's report card on the 7 most serious crimes: murder, rape, robbery, larceny, arson. What am I missing? I'm missing auto theft, and burglary. So those 7 crimes are tracked through the Uniform Crime Reporting Program. We have systems in place to capture all that. Reports that are done reported up to the state, Maryland State Police. Maryland State Police in turn forwards it up to the federal government. And in all the years that Uniform Crime Reporting has been around, 2019 was the lowest Uniform Crime Reporting numbers that the Harford County Sheriff's Office has ever seen. So the areas that we're responsible for policing in the county, we had the lowest crime numbers that we've ever seen. Obviously, not that we're immune from some of the worst things that the world can throw at us, but overall, we live in a very safe, and I always say very special county and community. From 2015 to 2019, a 5-year period, we've seen a 24% reduction in property crime and a 40% reduction in violent crime, which amounts to a 27% overall decrease in uniform crime reporting during that 5-year period. We are, I think as some of you are aware, the federal government is now moving away from uniform crime reporting, where each one of those incidents was counted. But if you had if you had a homicide, and there was also a robbery and an auto theft associated with it, only the most serious is counted, which would be the homicide. They are moving to the National Incident-Based Reporting System, which will capture all the fields individually. So that would be counted as 3 different incidents, and adding a whole bunch of others. So they're moving to a new system. This has been a challenge for us. The county executive and Mr. Boniface have been working with us, thankfully, on this is something we have to do, not a desire to do. There's a lot of funding that comes to the state and to the sheriff's office, to the county, to the sheriff's office as a result of being UCR, Uniform Crime Reporting compliant, and the conversion to NIBRS is also a requirement. We looked at it last year, and ronefully about $1 million to do the technology upgrades that are necessary, the computer changes to make us NIBRS compliant. Mr. Boniface and Mr. Glassman with the county IT department pushed $300,000 of that to our budget last year, in the current fiscal year that we're in right now. And I think you, council members, will all know that he has funded the remaining $700,000 in our operating budget for this coming year for FY21. Touching on the crime numbers, I did want to touch on the heroin epidemic. Again, something that we've been working on strongly for years with the county executive, the governor, and every other, each of you and every other person in our community. Very pleased that our numbers fell dramatically in 2019. We were down 21% in non-fatals and 40% in fatals. Still 50 people lost their lives last year to the opioid epidemic, which is still 50 more than any of us want to see. I'm happy that as of this morning's numbers, I get them every Monday morning, we are down 52% in non-fatals. We're down 37% in fatals from another decline year, and we're down 50% in total overdoses. So again, the reductions from, if you recall, from 18 to 19, we were the only jurisdiction in the state that had less fatal overdoses. It was significant from 19 to 20, and we are on pace, knock on wood, to see another significant reduction in that. I think all of our collective efforts have certainly made a difference. Still, we have lost 12 people so far this year to the opioid epidemic. I don't want us to lose sight of that fight in the face of the COVID threat, but I do think it's worth noting the significant impact that our collective efforts have made. One other thing I wanted to talk about from last year was improving our school policing. As you all are aware, we initiated the school resource deputy program at the elementary school level, adding 3 additional school resource deputies. This was due, in fact, a commitment from the county executive in support of the superintendent of schools, but a grant from the governor's office is paying for those 3 deputies. For some, it's not enough, but I think it's a great first step forward into getting our deputies into those 27 elementary schools that are outside the municipal areas of Harford County. You also note in our budget that there's a new index number for FY21 211400, and that is not new money into the budget, but working with the budget section. We all the costs associated with school policing have been centralized under that index number instead of crossing guards being one place in our budget and the school resource deputies or expenses related to either one of them. And I'm sure I'm missing some other things. All that's been centralized under a new index number within our FY21 budget. Still, a couple things I wanted to tout from last year for the sheriff's office, because the men and women here, as you said, Mr. Council President, do a great job. As you're, I think, aware, in 2018, the Harford County Sheriff's Office, Corporal Dave McDougall was the National Sheriff's Association's Deputy of the Year. We came back and won that same award in 2019 with Senior Deputy Richard Dean, who was recognized in Louisville, Kentucky, at the National Sheriff's Conference. I don't remember where it was, on stage. And I'm happy to say that for 2020, although we didn't win Deputy of the Year, our Victim Services section has won the National Sheriff's Association Crime Victim Service Award. This is an award that's normally presented also on stage at the national conference. The 3rd year in a row that the Sheriff's Office has taken national recognition. It's something I'm very proud of our deserving men and women for. Our Victim Services section underneath the CID, 2 ladies that are in that section are the recipients of this award. Unfortunately, that conference that was scheduled for the last week in June in Tampa Bay, Florida, has been canceled. So they are scheduled to receive their recognition at the winter meeting conferences in Washington, D.C. in February. Hopefully we are through this mess. The only other thing I had was some budget that I thought I would talk about, and of course I'm open to any questions you might have. But the budget highlights, I am thankful to the county executive, especially in these challenging times, in preparing his budget. The salary study implementation, this is, as you're aware, the 2nd phase to maintaining, making sure all of our positions, our law enforcement positions, our correctional positions, and our civilian positions are in a competitive status with those agencies that were part of the study. A lot to be done here for retention and recruitment, and that comes in in your budget. I think it's 2.8. Just $3.8 million overall that the county executive committed to this 2nd phase of the salary study implementation, and to also funding our computer and IT equipment needs. There's $778,000 that the county executive put in his capital budget that will update computers, equipment, and software here at the sheriff's office and across our locations, and another $551,000 the mobile data computers, which are the computers that are actually in the deputies' cars, separate from that $778,000. So I know it was a challenging year and probably going to be more challenging as we move through next fiscal year, but I'm appreciative that the county executive and his administration were able to both look out for the Harford County Sheriff's Office and our deserving deputies and make sure our office remains able to recruit and retain the finest that men and women that are out there as far as I'm concerned. So with that, unless there's something specific I didn't touch on, I guess questions.
Well, first of all, congratulations, and again, we appreciate your leadership throughout the county, and obviously along with your deputies and your office. I would like you though to again give me the numbers of on-the-road deputies versus your administrative staff and detention officers. I know that number's.
Well, we have I think it's 307 law enforcement deputies in total. And I'm looking at Miss Jennifer.
Yeah,
I don't have this tracing down here. I think it's 307 law enforcement deputies, roughly. There's about 140 correctional deputies, and the rest, and that's all ranked. So that's from the 140 would be from the major to detention center, because the warden is a civilian, down to the newest recruits, which we just finished their training a few weeks ago. We had 8 new men, 7 men and 1 woman just joined, complete their training. And of course, the 307 is from the sheriff down to the newest recruit. Were you looking for something more specific than that breakdown?
I saw a number 529, and I was just wanting to know how that broke out.
With our temps, it's actually a little over 600. I think it's 617
Okay.
employees at the sheriff's office, and some of that is, and of course, Miss Jennifer, that's why she's here, keeping me straight. Permanent employees in law enforcement, 380.5, and then that is because that 0.5 is where you have crossing guards who don't work full time. That's where you get the decimal. And permanent correctional employees is 166 approved positions, and we have 162 as of this report filled.
I appreciate that. The only other thing I'd like to comment on is I want to commend you again on how well you've worked with the health department in looking through the governor's executive orders as opposed to our businesses and social distancing. Appreciate that very much. And at this time, council members, any of you that may have questions, Sam, can you bring that screen up? Mr. Johnson.
Council President. Sheriff, I want to thank you and the men and women of the Sheriff's Department for your selfless service, especially during this pandemic. And I also want to have you send out some thanks to those that have gotten the COVID virus and that are now recovering. You guys are on the front lines, and we truly, truly appreciate everything that you do every day for the citizens of this county. That being said, so you said that you have 6.75 crossing guards. And I noticed in the budget, it was $256,881. With the amount of schools that we have, do you think that we could up the amount of crossing guards around the county?
I think we're actually short 2 spots, I believe.
Well, that's not 6. I don't think I gave a number as the number of crossing guards, because I don't even know what that number is off the top of my head. Are you looking, Councilman Johnson?
It's on page 342.
Bear with us just 1 second, please.
So I'm not sure of the 6.75. I think because we carry some of them in payroll as 1-hour employees because they're on-call positions. If that's what your question is, but I'm not sure, and I can't speak to this. I don't know if Major Dividend would actually.
Yeah, it's more than 6 crossing guards we have.
Well, no,
some of them are part-time.
13 or 15, I believe.
And some of them are temporary, like rotate and fill in. I'll get the exact number of it, but there are more than 6 crossing guards.
So
okay, if you can just provide that for us, then we can definitely move on.
Just Councilman, if I know in the past, we've asked the schools to prioritize that, we have the funding for the number of crossing guards that we have when we get that final number. But in order to add, is it 6.75 because that's full time?
Yeah, it's just the positions, because the part-time permanent ones are still part-time.
Right.
Because they're only the 9 months out of the year and they work 4 hours a day.
But we have to let the school system know that this is the number that we have funding for. This is the number that we employ. What's your priority for these locations? So I'm sure the school system has other places they would like us to provide crossing guards, but it's been our stance that we can't do that unless they want to fund those positions.
Okay, so you're working in with the school systems to provide those crossing guards for those particular places.
We have had conversations with the school system that if they want to add crossing locations, they'll have to find the funding within their budget to fund it for us.
So at the beginning of this school year, in the number, it's 15 or 16. I can't remember exactly. What we did was reached out to the school board and we asked them, provide us the 15 that you want us to staff. What are the ones where the most complaints are, the most dangerous intersections, that kind of thing. They provided that information back to us and we staffed that. And then we, as the sheriff said, if there's additional stuff, then they'd have to come up with some other solutions for that. But that's maximizing our potential with the crossing guards we have.
This is Kim.
Yes, sir.
Okay. There are 15 crossing guards budgeted for. That 6.75 is what the equivalent of a full-time employee. So it's considered an FTE 6.75, but we have budgeted 15 part-time crossing guards, plus some temporary money for others.
Okay, thank you. Okay, thank you very much. Sure. Thank you for clarifying. And Sheriff, so moving on to employment. You talk about competitive salaries. So how much money goes into recruitment?
We have a line item for recruitment.
We have a very limited line item for recruitment, and honestly, we just pull from other areas. The amount of money that we've spent in advertising has gone down because of social media, but it's not like so much of a dollar equated to it as more of creative thinking and ways to get our message and to get to other markets out there. So we really don't spend a substantial amount of money on our recruitment effort.
We have put a lot of effort into recruitment, and I think our numbers show that. Right now, we have 1 law enforcement vacancy and 5 correctional vacancies. We were almost, for a while, we had every law enforcement vacancy filled, and we were close to having every correctional one filled. So we have a hiring process right now going on for law enforcement. We have two law enforcement vacancies. We have 2 laterals in the process, so hopefully we're going to hire both of those. That'll take us to 0 again in law enforcement. And then in corrections, we have 5, and we have a hiring process going on. I don't remember how many are left in that process, but I don't think it's 5. So we might fill those vacancies as well. There was a time, if you recall, Mr. Councilman, that we were carrying, I think, up to about 15 vacancies in law enforcement and 16 or 17 in corrections. So we did a whole lot of things on our recruitment front, which included a diversity work hiring group that I brought here to the sheriff's office, and we changed some things. We were able to get the salary, working on the first salary study, we were able to get a better salary up. We did some changes to our pass-fail PT test. I changed our tattoo policy. I don't know that really got us extra people, but it did get the employees more tattooed. There were a lot of things that we visited. Recruiters here at the sheriff's office, so men and women were candidates, people who are thinking about applying could actually have a conversation with a specific recruiter and get their questions answered. So I think our recruitment efforts, as Ms. Blessing said, we've spent some money out of different parts of the budget, but I think it's been money well spent. But I've always said, I think you hear any police organization or correctional organization, the men and women in uniform out there on the street are our best recruiters. So hopefully we've pushed that message forward as well.
Yes, sir. What is the percentage of the department road deputies of minorities and women on the road, and what how can recruitment and retention help that number?
Overall, I don't have it broken down just on the road. We did, as I said, we established the diversity hiring work group several years ago. Met with them, went over the whole recruitment process because when I came to the sheriff's office, and our numbers are about the same now. We can get them for you and share, and happy to share them. Overall, our sheriff's office is very representative of the county as a whole in that it's about 87% white, 12% black, with a little other numbers mixed in. When you look at the sheriff's office, overall, that's about the same demographics of the sheriff's office. But when you go to law enforcement, that number changes greatly. When I came in as sheriff, we were somewhere around 4.3% of our force was black. I don't have the male-female broken down, but about 4.3%, obviously not representative of Harford County as a whole. It's been a several years goal since we got this up and running to try to improve that number, and we have not as of this point. Still working with my new sheriff's community board. They know that until the COVID paused everything, that was the number one thing that I wanted them to see what has been done on our recruitment front to try to get more women, more minorities into the process. So we have all the numbers broke down where at every step of the application process, the things that are mandated by the state, either by law or in COMAR, that are required to go through, and where we lose people in each step of the operation. And what we found is we lose, if you look at the applicant pool, so when the county puts out the posting for us on, what's the website? NeoGov. When the county posts that on NeoGov for us, we get an overrepresentation of minority applications. And when we first looked back at the tracking, I thought, wow, this is going to be great. We're going to have good numbers. And when it comes to the very first step of the show up, of those who show up for that initial PT test and written test, that we fall below a percentage that will even allow us to move forward on improving our numbers. So we lose a great portion that never show up. And there's a whole bunch of things. Are they really not interested? Are they just applying? Is there some kind of auto setting that lets them apply to everything? We've tried to go back and start contacting those people and say, why did you apply, and then not follow through. We have not had much success in getting answers there. So I am always open to improving our recruitment process. It's been a goal of mine. I inherited the agency with the numbers that were here. I want to improve them. That's a commitment I made and one we have not met up to yet. So I'm still hoping to move forward on that.
Yes, sir. Yes, sir. I appreciate that. I want to move on to a subject that, it gets a lot of recognition or ire from people, but I don't want to talk about the policy of it. I just want to talk practically about the fiscal part of it. So 287G program, how many deputies have been trained since 2016?
I think since we joined, I think it's been 11 total. The warden is not on this call. I think it's 11 total. I think we have 9 of those still. One has left the agency. And I think, I would say we have 9 currently trained. And I just got a text that says it's 13.
13. So how much does it cost to train those 13? And is it an in-service process that they have to go through?
Yeah, they get 3 weeks. I think it's 3 weeks. It's been a while since we had to send anybody down. The initial training is 3 weeks long. I'm probably going to get a text. Correct me if I say this wrong, but Charleston, South Carolina, the federal government pays for all the training. The only thing that our only expense if you want to call it that, is on-duty time. So if, during those weeks, those deputies are paid to be in the classroom while they're there. But when they come back here, it's everything else, books, travel, meals, everything is paid for by the federal government. Immigration and Customs Enforcement. When they come back here, it's not a full duty assignment. It's an ancillary assignment. So only at certain times during their shifts when they're doing something else, do they get redirected to address a 287G related matter.
Okay. And how much have we put out for hardware, software, and other things associated with the program?
Zero. Everything is paid for by Immigration and Customs Enforcement, which also included them running a T1 line that they paid for into the detention center. All the equipment is theirs, owned by them. So the program cost us nothing in hardware, software, or expenses. Again, there's probably, I had this question from some of the groups that aren't big fans of the 287G program. Do they get a note? Does an ICE member get a notepad or a pen or a pencil from the sheriff's office? Probably so, but the costs are so minute that they're not tracked.
Yeah, no, I wasn't worried about a notepad or anything like that. I was just looking at the MOU, and I was just looking at some of the language in there that says that the funds are subject to availability, and that they may be covered. So that's all I was asking about was that were those things covered by the federal government?
All of them.
Okay, and how much does it cost for us as an agency to detain these immigrants?
Well, nothing above the normal cost for any inmate because they are booked in on whatever charge that they are arrested for. So it could be a DWI, driving while under the influence. It could be a breaking in the cars in the middle of the night. So they're coming to the detention center no matter what. We do not have, as some counties in Maryland do, we do not have a housing agreement. So if someone screens in under 287G and are identified as being in this country illegally, and ICE decides, so the vast majority, they take no action, but they decide they're going to file for a detainer, that person has to be removed from our facility, goes to somewhere where they pay the county, Frederick County, Howard County, I think is still active. And down the shore, there's a county like Comico or Worcester, where they have housing agreements. And then I think the closest one out of state is in York, PA, a fairly big one. But we do not have a housing agreement in large part because counties that have them do make a lot of money because of the housing agreements. And I don't want to be seen as profiting off of this. This is simply a public safety program.
Yes, sir. The other question was that based off of the detention, and I guess, do we transport these folks?
We do not. If ICE files a detainer and they have to go to ICE housing, then ICE transports it. So there may be somebody who has a detainer file, but is still there on their local charges and has to go to court. So do they go into a transport van and take them to their court appearances, or if they need to a hospital visit or something like that? Yes, they do, but not transporting for ICE incarceration.
Okay, so there'll be no fiscal reason for the federal government to have to reimburse us for any of that, correct?
Correct. Yes.
And I think that's all the questions that I had. So once again, I thank you and I thank the men and women of the department, and stay safe out there and keep your heads on the swivel. Thank you.
Yes, sir.
Councilman Buell.
Yes, thank you, Council President. Sheriff Gerlach, too, would like to thank you and your office, your staff, and all the members of law enforcement here in Harford County. just for the great job that you've done over the past 5 years as far as reducing crime overall. So thank you, and just want to give you a big shout out. Councilman Johnson pretty much asked all the questions that I was going to answer. Could you send me those numbers that you're sending him to, please?
On the recruiting numbers? Or
the recruiting numbers and the overall percentage of, ethnic groups, all that stuff. If you could send that to me too, I'd greatly appreciate it.
Sure thing.
Let me just make sure I got it. So as far as SROs, we have them in all the high schools, correct?
Yes.
And so we don't have them in the elementary schools yet, and we're looking to put them in 3 elementary schools, I believe I heard you say.
Every high school and every middle school in the county is now covered. The municipal, I think they've also covered the ones in the municipal areas, high school and middle school. When you get out to the elementary schools, we have 27 elementary schools that are outside of the municipal areas. The grant that we used to fund these 3 positions, I think it was $380,000. So it was obviously not enough to hire any more deputies. So what we've done is run a little different kind of program here for the elementary schools, and that is each elementary school resource deputy has 9 schools. So they rotate. There's no guarantee. Part of the value in having a police officer at the school is the deterrent factor. So they're not at any school on a set schedule. So should there be, someone planning something, they wouldn't know what the hours are. But there is a deputy who knows that layout, who knows the faculty, who interacts with the young people, and hopefully would be there in a time of need. Hopefully there's never a time of need, but would be there. And then people understand that there is some sort of level of protection for those elementary schools.
Okay, and you said we were able to do this as a result of a grant?
Correct, a school safety grant from the state level. The costs were just a little bit above that, and we've used some of our, after speaking to the county executive, we used some of our funding.
Funded the salaries and the equipment. It was about $380,000.
Anything extra above that 380 came out of our budget.
Okay, so there's no guarantee that we'll get this grant money next year.
And I think that's part of the county, executive's concern as well. But there is no guarantee, but I think school safety, much like the opioid epidemic, and of course we have a grant-funded heroin coordinator, until the problem goes away, the problem being the safety, how you provide the safety of the schools. I think that after COVID costs, maybe having the state to look at their costs, I think that the grant funding will be available for some years to come. I could be wrong, but we went into that thinking that this is not a one-year thing on behalf of the state. This is a program they're going to need to fund for several years. So hopefully I am right in that assumption.
Okay, well, thank you very much. And again, thank you for the outstanding job that you and your office and all your deputies and your staff is doing. And I'm concerned that maybe you're going to work yourself out of a job, and then we'll have to bump Colonel Davis up to sheriff or something like that. So thank you again. Thank you, Council President.
Thank you, Mr. Bueller. Mr. Woods.
Thank you, Mr. President. Thank you, Sheriff, and your team for being here and answering our questions. I have a quick question about something that's really not directly related to you, but they are housed at the jail. The commissioner's office, how's that running right now? And do you know, are they open? I've had a couple of constituent questions come in lately, including some domestic related issues, and we want to know how to proceed with contacting the commissioner. And I was under the impression they were still open, but if you could help me with that some.
So, of course, that falls under the court system, although they're housed in our building there in that separate area. So you don't even come in through the lobby access to the detention center. They have their own access. I'm told there's no interruption in that service. I know the courts have gone to great lengths to make sure that orders, peace orders, protective orders, that process is still flowing, where the rest of the court's business can kind of has been put on hold. Of course, part of that process, you get a peace order or protective order from the commissioner at times, a temporary. So that process is still up and running. To the best of our knowledge, we haven't heard any interruptions in service since this thing began.
Yeah, that's what I explained to them. The recent contact was there was a deputy that came out to help the constituent and work through the issue, but they felt like they didn't know what to do next if the commissioner was around, so they reached out to my office, and we directed them still to go to the commissioner office if they felt, and also call you back if they felt in danger, of course. The state's attorney is up next. It'd probably beneficial if you stayed on a little bit, list of part of his presentation, because I was going to ask you about court services and a female deputy helping out up there, or any female deputies being in court services. But I know the state's attorney is going to bring that up in his presentation here in a few minutes. So I don't know if you just want to lead on with that, or if you know have you talked to them with that problem, or of their need of a female up there.
You talking about just courthouse security?
Court services. He'll explain it, and I'm sure there's an issue where if they have a female detainee and the female goes to the bathroom or goes somewhere, there's not a female officer to or deputy to maintain that security level.
And just like Councilman Johnson's question, he touched on the female ratio as well. It's not been great. We're looking at trying to find ways to attract more females to the position. But I'll stay on the line. I know we do not currently have any females. Joanne Volker had retired last year. She was our only female deputy in court services. But I'll stay on and answer that question. But Councilman Wood, you did maybe think of saying the deputy wasn't sure what to maybe do or what the status of things was concerning the COVID crisis. Maybe think of our COVID confusion center here at headquarters on the second floor in the conference room there. We've actually stood up because of so much misinformation, so much need for rumor control, so much information flowing out from the state, from the DES, from the county, from the Center for Disease Control, trying to filter all that into one place and make it usable for our deputies or other law enforcement agencies. So our deputy should know that if he's out there, he's not 100% sure, he can pick up the phone, call into the fusion center, and get the right answers. And we've had a lot of that related to what is an essential business or is not an essential business. And if they don't know upstairs, then we can call right out. So there's one more thing that we did in response to the COVID threat. If they don't know upstairs, they can reach out to the state center and try to get the answer. So we do have that resource available for all of law enforcement in the county. And the example you gave of the deputy not being sure, we went out to the call. He has a resource, or she has a resource available to them to get those kind of answers if they're not sure in the COVID world what's what.
I appreciate that. Actually, that was my final question was going to be about the Fusion Center and seeing how that's worked, and if any of the other agencies were participating or working out with you guys on that, or calling in if they needed anything, or if you even put it out to them.
We're staffing it with the sheriff's office, an analyst and a sworn person each shift. Overnight, I think it's just a sworn person. We're staffing it around the clock, but it's available to all the allied agencies, state police, or the municipal agencies.
Excellent. And finally, the question with right now, obviously, with people getting more worried about their future and less income coming in, I fear with the crimes of opportunity popping up and breaking in the cars, things of that nature, possibly coming up. I know when, as you know, my role with Homeland as an emergency manager with FEMA, we obviously in disaster areas, you see a lot of those crimes of opportunity. Some that really scare me are when people see people leaving grocery stores, which none of this has happened here that I know of. People would see people leaving grocery stores, follow them home, rob them, things of that nature. And I think that type of stuff happens in disasters in other areas. And I'm just hoping that you guys would, because you do a great job putting information out to the community, especially with keep your cars locked and things of that nature. I was hoping you guys could maybe work on something like that to get the information out to the community, just to remember to stay safe, not just at home, but keep your security going too. But you guys do a phenomenal job with that, and I'm sure you thought about it. But
We have had discussions about it. The crime numbers are actually down. Domestic violence over the 5-week period did take a small, very small, not a spike. We were concerned that there might be a spike, but a very small increase. But other than that, everything has been down. But just like I gave you the example of the 2 we locked up for breaking in the cars in the middle of the night, I can tell you one of those, we probably locked him up 15 times since I've been sheriff. And my concern with him is we lock him up, we take him to the jail, we risk exposure into the facility, and he gets let out the next day, where we're going to have to lock him up again shortly. That turnover, that recidivism or repeat customer at the detention center who is not making good life choices to start with, I can guarantee you if he's out there breaking into cars in the middle of the night because he has a substance abuse issue, he is not probably practicing good social distancing the rest of his day, and he runs the risk when he's out of getting exposure. So that concerns me actually more than we tried to message everybody, as you said, Mr. Councilman, as far as lock your cars. Sometimes it just seems to fall on deaf ears. We had a call. I know we had a break-in the other day at Togi Mom Pa parking lot. As much as we've messaged there, we put a sign up at all the parking ride locations. I keep reading these reports of men or women leaving their wallet, leaving their purse in the car, locking it up, and coming back to a broken window. We do our very, very best, and I got to give my Office of Media Communications all the credit. They do an absolutely exceptional job with our social media messaging. I don't know how to reach those that don't want to be reached.
well, thank you very much.
Yes, sir.
Thank you, Mr. Woods. Citizen Budget Advisors, anyone have a question of the sheriff? Seeing none, Sheriff Gaylor, truly appreciate you coming with us today, and your staff. Major Givenden, I want to give you a belated happy birthday while you're sitting in front of me. So appreciate you guys coming. Thank you. And next will be our state's attorney.
Thank you much. Don't cut your statement.
Council, it's my pleasure to again welcome our state's attorney, Al Peisinger. Based on the interference that we had on, I guess, was Friday, we asked him to invited him to come back today, and he graciously has accepted. So, good afternoon, sir.
Can you hear us better today?
Yes, sir.
Yes, sir. Okay, perfect. Just to try to speed things along, and also for Sheriff Geller, because I know he is quite the busy man. Joe, I just addressed two of the questions you had. The commissioners are definitely up and running for domestic violence situations like that. That their service is not interrupted. The orders that are being issued are temporary. The permanency hearings are being delayed, but that does not the temporary does take effect immediately upon service. So the commissioners are working, and that has not been interrupted for purposes of domestic violence. No worries. Also, I'll quickly address, maybe more so fully, but the bathroom issue that you mentioned that basically relates to the bathroom issue, Councilman Woods and Sheriff Geller, it's really not gender specific. It's really just a total overall safety issue because it could happen for a male also. But the fact that there are no female deputies in the courthouse for purposes of courthouse security, it might heighten that problem for a female, that they would not be going in and out of the bathroom, or there's no reason for a deputy to be checking the bathroom. So that's really the issue. It's not gender specific. It's a total issue. If I'm trying a case and the defendant's a male, I could be standing next to the same gentleman that I'm prosecuting for a crime in the bathroom with no security or protection whatsoever. And if not everybody's happy, as we discussed on Friday with the situation. So it's really not gender specific. It's just the fact that there are no female deputies as part of the regular schedule for courthouse security, that it could pose maybe a little bit extra issue for one of our female prosecutors. So if that addresses your two quick concerns, and Sheriff Geller, you're welcome to stick around if you wish, but I know you're a busy man.
Thank you. It does.
If I could just jump in with you, that's the first that kind of came to my attention since Joanne Volker had retired about not having a female assigned for security. She was normally down at 220. We can certainly look at it. We have the challenge at the detention center all the way down to a few number of females, but there are one or two females in transport. So when those transport officers are at the detention center, maybe we can have them, do those type of sweeps, or at least just be seen within the facility. As I think everyone's aware who's on the call, the courthouse deputies are, although they're Maryland Police Training Commission certified law enforcement officers, they are basically contractual temporary deputies with us. So they are not, I can put them on the street tomorrow if we had a hurricane, but they are not your normal law enforcement deputies. They are temporary positions. And basically what we get there for the most part, for the entire part, are retirees. I think every single one of them is a retiree from either here or another agency that come on board, and where our recruiting efforts are challenging in law enforcement overall, where you have a whole career and promotion through the ranks, and you can look at the whole pay structure and maybe plan out your life. This recruitment for temporary deputies is more challenging because it's a flat rate. Benefits are more limited that come with it. Somebody just leave. So I think we've done a lot, again, working with the county executive and his team to make that job more attractive. We've been able to up the salary. But I can tell you, we're just not getting the female applicants when we post. We have one vacancy there now. We thought we had it filled. Which would have been another male, but he backed out last night. So we'll be doing another recruitment for that temporary courthouse deputy position. I would like to say if we can fill with a female, I'd be happy to apply. I'd be happy to apply. So we will work with you best we can.
Thank you, Sheriff Geller. I just wanted to free your afternoon up if possible. So
thank you, Mr. Podsinger. Appreciate it. Again, if you would, just like on Friday, if you would bring us up to speed on how COVID-19, the pandemic, has affected your office and the court system, and how you're dealing with it, and then anything else that you would like to make us aware of before I open up for questions.
Perfect. Thank you for the encore. Sorry for the difficulty on Friday, but if you don't mind, I'll start from the beginning, and I'd like to thank you and the county executive's office for supporting us last year, and that sort of coincides with how we did deal with COVID. One of the positions that we did ask for was for an IT person to be housed with the state's attorney's office, and we were very fortunate to hire a young man by the name of Chris Overby. And when we went with the COVID scenario, made us go remote. Without him, I think we'd be lost, to be absolutely honest with you. We had no in-house support whatsoever. So last year we asked for that help. You were able to support us. We were able to get that help, and especially with the situation we're facing. So with COVID-19, our office is pretty much at a request of myself, 100% remote. We come in when we absolutely necessarily have to. When we're doing that, it is only 2 people coming in one of each of our 4 buildings. We are limiting our numbers. We started off doing a rotation, and then we went to a full remote. We are still doing all of our hearings by remote. The judiciary bench is doing their hearings by remote. So we have up to speed where we are doing all of our emergency hearings by the order of Chief Judge Barbera. So we are still functioning, but we are functioning in much less capacity. All of our regular trials have been postponed. All regular hearings have been postponed. We were relatively dealing with the emergency matters, which for most part for the criminal side is bail reviews. So if there's a new arrest, bail reviews are still happening. With some of the orders and suggestions of COVID-19 and the penitentiaries and our local detention center, some of those modifications hearings are being heard to see what we can do there. We did actually have a very fruitful conversation with the Sheriff Geller and the judiciary in reference to our local detention center. And I think what Sheriff Geller and the warden have done since day one and prior to the to the COVID-19 hit Harford County, our detention center has taken tons of steps to protect their staff and the inmates that are there. So we've been pretty fortunate with that, and we were able to update the court system as to the steps that we've been taking. So, that's where we are with COVID, and, our office is able to function with COVID because of your support last year, helping us get that additional position of the IT person. So that has been tremendously helpful for us. So that's where we are with COVID. One of the other things I did mention on Friday was when it comes to the numbers, one of the things that we were able to do was to give back to the county through a bill that we introduced to the state that is taking 12 positions that are currently under the state's attorney's office, and they are going to fall under the state for child non-support enforcement. 17 other jurisdictions out of the 24 already do this with the state. It was a purely economical, frugal decision. We were every year paying about $544,000 this last year. This year, we would have been paying approximately $555,000 to $560,000 for those 12 positions to function based upon the legislation introduced and which passed through the House and the Senate and waiting for the governor's signature, or will become law on May 7th. That will transfer that burden of the county back to the state, and the state will pick up those 12 positions at 100% on them. Our services in the county will remain 110% the same. To my knowledge, the state has no intention of moving them from the location they are on 101 Main Street. The 9 of those individuals will go to the DHS, and the other 3, which are attorneys, will go to the Attorney General's office. So their 110% salary will now be picked up, and their functioning costs will be picked up from the state versus the county. So it saves the county about $550,000 every year with an annual increase of about 3%. So over the next 3 years, we'll save a little about $1.6 million by transferring that cost back to the state, along with most of the jurisdictions have done that. And we're pretty frugal. Ms. Fiddler is with me. I think we mentioned that on Friday. Our operating costs, we have a little budget of a little over $6 million. Our operating cost is less than 3% of that $6 million. About 97.2% of that budget is actually salary. So we're very frugal. We pinch every penny we can to make it go as far as we possibly can. We are very cognizant of the fact that we're spending tax-paying dollars, and we don't spend it useless. We're very careful where we put it and how we put it. That being said, one of the biggest things I mentioned to you on Friday was the need for probably a new location. And I'll put it right out there, being new to the administrative side of asking for a location. I've never had to do that in my 22-year career, but in this position, we have to look at that. And we have met our maximum capacity at pretty much every single location where we are at. We're in 4 different locations on Main Street. When we move the 12 individuals over July 1, we will be reduced down to 3 locations on Main Street. I have a location at 109 Main Street on North, where most of those offices that are occupied by lawyers are doubled up. They're really designed more for one. We've had to double them up and put 2 lawyers in an office. We have turned our storage room into a conference room at the courthouse. We have made every opportunity we can to expand where we can and how we can, but we have hit maximum capacity. One of the issues also that are affected by that is our grand jury. Every other week, we bring 23 citizens in from the county into our grand jury room. Our grand jury room is designed for 10, and we put 25 people in it. 23 citizens and a witness and a staff member of one of my lawyers are there every other week, and we're cramming 25 people in a room designed for 10. So when you mention COVID and when we get back and how do we social distance, I can't even consider that in that room because we're already over twice the capacity. It's the, one of the plans that I've had several conversations with different council members, with the delegation back on December, mentioned it to the delegation back in December, mentioned it to the county executive's office. I don't know if it's a capital budget, how we do this, but I'm going to be asking for everybody's help in how do we relocate actually one facility would be fantastic if I can get my entire staff in two buildings, really, realistically. The Family Justice Center would probably never be combined back into the state's attorney's office as a whole, because we work hand in hand there with the sheriff's office, SARC, Family Children's Services, Maryland State Police, my office, and it's designed that way. DHS is there to actually better serve the citizens of the types of crimes that have one center to deal with that as a whole. But I have two trial teams separated about 6 blocks apart. It would be very nice to have those two trial teams together. It'd be very nice to have a larger grand jury room or a training room that could be used at the same time for my staff. For me to have an office-wide meeting or even a team meeting, I have to look outside of my buildings for that. And actually, you were kind enough, Council President, to offer your building and meeting space at one point when we did our training there, when we brought our whole team in for unbiased. So it was really, I appreciate that, because for us to try to find a room to put 70 some people in, I can't do that within my own means. So that was one of the big issues that I will be asking and moving forward. I'm not sure how we do it, but there are maybe 1 or 2 locations that I've identified that I have mentioned that may work to several different people. So I'll be looking for and maybe asking for some guidance and or help as to that, because that is going to be something we need to plan for in the future sooner than later, is how do we get into one location, or how do I expand the locations I'm at, which the courthouse here is very difficult. That being said, all the money spent in the courthouse over the last few years, and and most recently just about completed, we've updated the courthouse. But when doing so, $0 of that update went into the state's attorney's office. So I just want to make sure that's perfectly clear. Even though the courthouse was updated, the state's attorney's office was not updated in any way. We were not expanded. We couldn't be expanded. And that's how the bathroom issue came up. I mentioned to you, when we have personnel trying cases, when my lawyers are trying cases and those individuals are on the street, that prosecutor could be in the same restroom as that defendant, and that defendant could be on trial for murder or DWI or assault. It could be anything if they have been deemed to be placed on bail, and it's a safety issue. It's a huge safety issue to have that situation where my prosecutor could be in a bathroom, a public bathroom, with family members of that defendant or that defendant. We do not have a bathroom here in the courthouse. The other buildings do, but this one does not. And that's a big issue. My staff has to go through security to use the restroom. That's just a big issue. It'd be really nice if we could have one location, have all our prosecutors in one location, and be able to function like that. I think it would also help professional growth. One of the things we have started with every new hire, we have a mentor. So if you're a young prosecutor in your career, you have been teamed up with a more seasoned prosecutor as a mentor, independent of just our supervision chain. So it'd be nice to have them together where they can actually talk and not have to be separated by 6 blocks. So for professional development, it would help. So I will be asking for help. I will be reaching out. How that works, I'm not sure. That's why I bring it to your attention now. I know I've been talking here and there, but I would like to officially put it on the record that if it's a capital budget I need to ask for, then we'll be asking for that next year. If it's something that can be done without a capital budget, be great. So I do appreciate that. But that being said, last year, the county and the council was very good to us. It did honor our request. We were able to expand to our IT department, which was a huge, tremendous help. This year, I don't know where we would be without Mr. Overby right now. And this year, it appears that from the numbers that Ms. Fiddler has looked at, we are fully funded again. Our staff is fully funded. So we're in pretty good position. So I do appreciate the support. I would ask you to continue that support. And I'd like to thank the county executive's office and the council for that support. So other than that, I think I recapped everything from Friday. I will take any questions. I know Mr. Johnson had 2 questions on Friday. I think we addressed them on Friday. One of them was, I think, dealt with the Family Justice Center, which is the center I didn't mention that would never break up, where we all work together in that building to support the victims of very specific types of crimes. And then the other part was the non-support unit of that money going to the state to pay for, and those positions going to the state and not the county's burden of those 12 positions anymore. So I'll be happy to address them, Mr. Johnson, again, if you want me to do that again, or if I did not answer them properly for you now, let me know, and I can gladly answer them again.
First,
you answered very well. Thank you.
okay. So first, let me say, shortly after I was elected, I was taken on a tour of your facility with then State's Attorney Castley. And I couldn't get over the fact then that the office was spread all over basically the downtown area. And so I understand your challenges, and I would ask you as your discussions move forward with the administration, just keep council members abreast as you move along. Okay. And again, with that, council members, any questions? Mr. Johnson, did you want to follow up?
So thank you, Council President. I'm satisfied.
Thank you. Council members, anyone else? Seeing none, citizen advisors? Possinger, I think you did an outstanding job this time. We appreciate you coming forward. And I look forward to seeing you soon. If you have any questions, don't hesitate to call.
Thank you very much. Enjoy your afternoon.
Thank you. Thank you. Ms. Dixon?
Yes, Mr. President.
That's everyone, isn't it?
That is everyone.
All right. Anything you'd like to add before we go?
Nope, just thank everybody for their involvement in the different process we use this year. I appreciate everybody's cooperation.
Thank you. Mr. Kearney?
President, I have nothing to add.
Thank you, sir.
You're quite welcome.
Mr. Boniface?
I don't know what's going on. Yeah. We're in good shape. Thank you, sir.
Thank you. Dr. Hill? Mr. Williams? Okay. Mr. Reppert?
Thank you.
Mr. Tibbs?
Everything is fine. Thank you very much, sir.
Thank you. Mr. Scotton?
It's fine here. Thank you very much.
Thank you, sir. Ms. Hergenhan?
Thank you for the opportunity. It's been very enlightening. I think Citizens Committee has a lot of work to do.
Thank you, ma'am. Mr. Ondish?
Going along with what Cynthia just said, if it's easier, we'll work with Mila to get a couple of these sessions set up for the Citizens Budget Advisory Board, and I'll work with the council president, the council members, and Mila to figure out how this will work for our comments to get out there. So more on that to come here shortly this week. Thank you, Mr. President.
I want to thank all of you for your time dedicated to this process. We appreciate it, and be talking to you soon. Thank you.
This meeting is no longer being